The monitor flatlined at 11:47 p.m., and every doctor in that trauma bay stood frozen, arguing about paperwork while a decorated combat commander bled out on the table. Then a night shift nurse nobody had ever bothered to learn the name of walked through them like they weren't there, called a procedure none of them recognized, and brought him back in under 40 seconds. The room went dead quiet. Then a colonel stepped through the doors, took one look at her face under the fluorescent lights, and the color drained out of him completely. "That's not possible," he said, his voice dropping to almost nothing. "We buried you. If this story already has you holding your breath, follow my channel, hit like, and drop a comment telling me what city you're watching from. I want to see how far this story travels." Now let's go back to the beginning. The night shift at Mercy Hollow General Hospital started the same way it always did. Short-staffed, underfunded, and completely indifferent to anyone who worked it. Delia Voss had been pulling nights for 3 years in the med-surg unit, and in that time she had learned 2 things about Mercy Hollow General. The supply closets were always half empty, and the people in charge liked it that way. It kept the budgets clean. It kept the complaints manageable. It kept the nurses who actually did the work too exhausted to cause problems. She was 34 years old, lean in the way that comes from never quite having enough time to eat a full meal, with close-cropped dark hair she kept pinned back because it stayed out of her face that way. She didn't wear much. A watch she'd had for over a decade, a hospital ID clipped to her breast pocket, and a pair of compression socks that had seen better days. No jewelry, nothing that could catch on equipment or give a patient something to grab. Delia had a reputation on the floor, though not the kind that got you recognized at staff meetings. She was the nurse other nurses called when something went wrong and they didn't know what to do. She was the one who noticed when a patient's breathing pattern shifted 2 hours before the monitors caught it. She was the one who checked the chart notes nobody else read and flagged the medication interactions that slipped through. She did it quietly, without announcement, and when it mattered, without waiting for permission. What she was not was popular with administration. Voss, the charge nurse, a heavy-set man named Paulson, who wore his authority like a costume, appeared in the hallway holding a clipboard. "You submitted another equipment report. The portable defibrillator in Bay 4 has a response lag. I documented it. You documented it 3 times already, and it still has a lag." She didn't stop walking. "So I documented it again." He followed her to the supply station. "The director wants you to stop filing reports through the external portal. Use the internal form." The internal form gets reviewed quarterly. She pulled 2 bags of saline from the shelf and checked the labels. "The last time I used it was 8 months ago. Nothing was fixed, so I used the external portal." Paulson's expression shifted into something that wasn't quite a smile. "You know Dr. Harmon has flagged your file." She set the saline bags on the cart. "Dr. Harmon flags everyone who makes his unit look bad. That's not the same thing as being wrong." She pushed the cart down the hall before he could respond. Marcus Harmon was the chief of trauma surgery at Mercy Hollow General, and the fact that he was talented made everything worse. He knew he was talented. The hospital board knew it. The local medical press knew it. He had built his reputation over 20 years on a particular combination of skill and controlled aggression. The kind of surgeon who operated fast, cut clean, and demanded that everyone around him function as an extension of his own decisions rather than as independent thinkers. Nurses who questioned his orders got written up. Nurses who corrected him in front of colleagues got reassigned. Nurses who filed formal complaints against his unit got quietly buried in paperwork until they transferred out or quit. Delia Voss had been filing complaints against his unit for 8 months and hadn't done either. That made her, in his assessment, a problem that hadn't been solved yet. She was checking in on Mr. Alcott in room 12, a 61-year-old man recovering from a cardiac catheterization who kept pulling his oxygen line out because he insisted he felt fine, when her pager went off. The trauma bay. She wasn't assigned there tonight, but that was the code she'd been given when she started. If the number came up, come anyway. She came anyway. The trauma bay at Mercy Hollow General was a wide, badly lit room at the end of the east corridor that smelled like antiseptic and recycled air. Tonight it had 4 people in it when she pushed through the doors. 2 residents who looked like they hadn't slept in 2 days, a surgical fellow named Torres who was pale in a way that had nothing to do with complexion, and a man on the gurney who was not doing well. He was large, broad through the shoulders in a way that suggested years of physical conditioning. And he was in his mid-50s, with a face that had weathered something harder than ordinary civilian life. He wore civilian clothes, but they'd been cut away at the torso, and what was underneath told her several things in the first 4 seconds. Scarring, old and systematic, not surgical, tactical, the kind of pattern that came from years of operations in environments with limited medical support. He was conscious, barely. His eyes tracked the ceiling in the unfocused way of someone whose blood pressure was dropping faster than his body could compensate. "What happened?" she asked Torres. "MVA. Vehicle rollover off Route 9. He walked into the ER 40 minutes ago, said he was fine, then deteriorated." Torres was looking at the monitors. BP is 84/50 and falling, heart rate 120. We've got 2 large bore IVs in, O negative running. Has he been scanned? CT is backed up. We're waiting. What's his respiratory effort? Torres frowned. He's breathing on his own. That's not what I asked. She was already at the bedside, pulling on gloves, doing the thing she did that made residents uncomfortable, which was actually look at the patient instead of the monitors. She pressed 2 fingers to the left lateral chest wall, then moved methodically, reading what she found with her hands. She found it on the 3rd press, the subtle paradoxical movement, the way the chest wall moved wrong on the left side, inward, on inhalation when it should move out. She checked the trachea. Midline still, but barely. She straightened. He has a tension pneumothorax developing on the left. Torres stared at her. The chest X-ray was 40 minutes ago and his condition has progressed. Look at his neck. She pointed. The jugular veins were distending visibly now. Listen to the left lung field. One of the residents moved to do it. He put the stethoscope to the left chest wall and went very still. Breath sounds, Delia said. Left side. Diminished, the resident said quietly. Torres was already reaching for his pager. I need to get Harmon. There's no time. She kept her voice level, not because she felt calm, but because panic was contagious and this room couldn't afford it. If we wait for Harmon to answer his page, get dressed, drive in from wherever he is, this man's heart shifts out of position and he arrests. We have maybe 8 minutes before that window closes. You're a nurse, Torres said. It wasn't mean, exactly. It was the specific bewilderment of someone who had been trained to occupy a particular box and couldn't process someone else stepping outside of theirs. I know what I am, she said. I also know what's happening to him. Get the needle decompression kit. I can't authorize, Dr. Torres. She looked at him directly. Not angrily, not with the desperation of someone begging, just steady, the way a wall is steady. You authorized me to come in here when you paged me. I'm telling you what I see. Get the kit or I'll find it myself, but either way, we're not waiting. Something in his face broke loose from its anchor. He turned to the supply cart. The patient's eyes found hers. He was lucid enough, just barely, to know he was in trouble. Stay with me, she said. I need you to breathe as normally as you can. He managed something that wasn't quite a nod. Torres had the kit. She told him the landmark, second intercostal space, mid-clavicular line, left side, and walked him through it with her hands on his, not because he didn't know the anatomy, but because his hands were shaking and hers weren't. The needle went in. The rush of air was immediate and audible. The patient's blood pressure began climbing on the monitor within 90 seconds. Nobody in the room said anything for a moment. Then Torres exhaled so hard it sounded like something had given way inside him. How did you know? The pattern of injury from the rollover, combined with the trajectory of his deterioration. The X-ray missed it because it was an early presentation. By the time we got him here, it had progressed. She peeled her gloves and stepped back from the gurney. He needs a chest tube now and a thoracic surgeon on site. Not paged, on site. Torres was already on the phone. She stayed until the chest tube was in and the patient's numbers had stabilized enough that the residents had color in their faces again. Then she washed her hands at the sink, dried them on the paper towels that were always too thin, and walked back out into the corridor. Paulson was waiting. She registered the look on his face, not concern, not relief that the patient had survived, something administrative and carefully arranged. Harmon's on his way in, he said. Good. The patient needs proper follow-up. He's not coming in for the patient. Paulson fell into step beside her, which forced her to slow down or make the awkwardness obvious. She slowed down. He's coming in because Torres called him, and Torres told him what happened. She didn't say anything. You performed a clinical intervention without attending authorization. I provided clinical guidance to a licensed physician who performed the procedure. That's a distinction Harmon doesn't find meaningful. Harmon can take it up with the patient's chart, which will show a documented clinical emergency and an intervention that reversed a life-threatening condition in the window of time available. She stopped at the nursing station and pulled up her documentation on the terminal. I'm noting the timeline now, time of assessment, time of intervention, time of patient stabilization, all of it. Paulson watched her type. You're not going to make this easy. I'm not going to make it dishonest, she said. Those are different things. What? Marcus Harmon arrived at Mercy Hollow General at 12:43 in the morning, wearing the particular expression of a man who had been pulled out of sleep and was going to make sure everyone understood the sacrifice that represented. He went to the trauma bay first. He stood over the patient, stabilized now, chest tube in place, a resident charting quietly in the corner, and reviewed the case with the specific efficiency of someone building a case rather than conducting a clinical review. Then he found Torres in the break room. The conversation that followed was short. Torres emerged from the break room looking diminished. Delia was documenting a medication update on another patient when Harmon appeared in the corridor. He was taller than most people expected from his reputation, and he moved like someone who had never once been uncertain of where he was supposed to be. Voss? She finished the entry before she turned. Dr. Harmon, walk with me. She walked with him to the small office near the East Nurses Station that the charge supervisors used for documentation. He closed the door, which was not a good sign, and stood with his arms crossed and his eyes on her with the direct appraisal of a man assessing a structural problem. Tell me what you think happened tonight, she told him, clinically, accurately, without editorializing or apology. He listened. That surprised her slightly. She'd expected interruption. When she finished, he said, "And you thought it was appropriate for a night shift nurse to direct a surgical fellow through a decompression procedure. I thought it was appropriate to prevent a patient from arresting in the trauma bay. The fellow could have managed. The fellow was hesitating. The patient had 8 minutes, possibly fewer. There was no attending present and no attending reachable in time." She kept her voice even. "I've submitted 3 reports about the equipment delays in this unit and 2 about staffing coverage gaps on overnight trauma. If those had been addressed, this situation might have presented differently." Harmon's jaw moved. "Your reports." "My reports." "Your reports," he said again, and now his voice had shifted into something quieter and more deliberate, "have been reviewed by administration and found to reflect a pattern of overreach by a staff member who consistently fails to operate within the defined scope of nursing practice." She let that sit in the air for a second. "The patient is alive," she said. "The patient is alive because a physician performed an emergency procedure. A physician I guided through it because his hands were shaking. The temperature in the room changed. Harmon uncrossed his arms and put both hands flat on the desk, leaning forward slightly. I want you off this floor by end of shift. On what basis? I'll have the documentation on the director's desk by 6 a.m. The patient's chart will contradict it. Charts get reviewed, he said. Interpretations vary. He straightened, adjusted his jacket, and walked to the door. He paused with his hand on the frame, not looking back. You should start thinking about whether this hospital is still the right fit for you, Voss. A lot of good nurses have come to that conclusion and been happier for it. He left. She stood in the empty office for a moment, the fluorescent light buzzing faintly overhead. She thought about the 8 equipment reports she'd submitted to the external portal. She thought about the photograph she'd taken of the defibrillator lag timestamp on her phone, the one she'd emailed to herself with a date stamp, the one she'd done 3 months ago after reading an article about a hospital in Tennessee where the same kind of institutional neglect had killed someone and the nurses who'd warned about it had been dismissed without records. She thought about the patient in the trauma bay, whose chest was now moving correctly, whose blood pressure was stable, who was going to wake up tomorrow. She went back to work. The rest of the shift moved the way bad nights moved. Too fast in the wrong places, too slow in the others. She handled a post-op complication in room 7, a fall risk in room 3, a confused elderly woman in room 9 who kept asking for someone named Harold, and who Delia stayed with longer than she strictly had time for, because the woman was frightened and there was nobody else. By 4 in the morning, the ward had settled into the particular quiet of deep night. monitors beeping their steady rhythms, the occasional footstep in the corridor, the distant sound of a door. She was at the nurse's station catching up on documentation when she heard the trauma bay doors open. Two men in military uniforms, not the civilian-adjacent kind, the actual kind, dress greens, rank insignia she identified automatically and then made herself look away from. One was a colonel, late 50s, compact and deliberate in the way of men who had spent careers making decisions under pressure. The other was a younger officer, a captain, who moved with the hyper-alert quality of someone whose job was to anticipate threats. They went straight to the trauma bay. She heard the murmur of voices, the resident explaining something, the monitors. Then the colonel came back out and stood in the corridor, and his eyes found her at the station. He walked toward her. "Are you the nurse?" he said. "The one who was in there earlier?" "I'm one of the nurses on shift. The one who identified the pneumothorax." It wasn't quite a question. "Yes." He looked at her face, not in the way that most people looked at her, past her, around her, through her, but directly, like a man trying to place something, like a man who had walked into a room expecting one thing and found something that didn't fit his map. "What's your name?" he said. "Delia Voss." His face didn't move, but something shifted behind his eyes, a rapid recalibration, the kind she'd seen in people absorbing information they hadn't prepared for. "Where did you work before this?" She kept her expression neutral. "Various hospitals in the Pacific Northwest." "Before nursing?" The question landed differently than the others. She held it for a second, measuring. "Before nursing, I had other work," she said. "Can I ask what your interest is in the patient's treatment?" The colonel studied her for a moment that lasted slightly too long. Then he said, "The man in that room is General Warren Taft. He commands the 4th Special Operations Support Brigade out of Fort Caldwell. He is also one of 12 people in this country who have been briefed on a classified operation that is currently active." He paused. "His survival is not an administrative concern. It is a national security concern." Delia said nothing. "I've reviewed the timeline the resident gave me," the colonel continued. "You had approximately a 7-minute window before decompensation. You identified the injury and directed the intervention. Nobody else in that room called it. The physician performed the procedure." "You know what I mean." He kept watching her. "I'm going to ask you again, and I'd like a straight answer. Where did you work before nursing?" Down the corridor, the trauma bay doors opened. Torres came out, saw the colonel, and started toward them. That bought her exactly the time she needed to decide what she was going to say. She looked at the colonel, this careful, controlled man who had looked at her face and asked her a question that nobody at Mercy Hollow General had ever thought to ask. And she said, "Somewhere that doesn't appear on my resume." His breath came out in something that wasn't quite a laugh. It was too controlled for that. But it was the sound of a man who had just confirmed something he hadn't wanted to be true. Torres reached them and launched into a clinical update. The colonel listened, responded appropriately, asked the right questions. But his eyes, twice during that conversation, came back to her face with the particular expression of someone pulling on a thread they weren't sure they were ready to follow to its end. She went back to her documentation. At 5:15, the morning shift supervisor called in sick. At 5:30, the hospital director, a man named Gerald Fitch, who wore his suits half a size too large and smelled of the particular cologne of men who'd been important in small rooms for a long time, arrived earlier than usual. At 5:45, Marcus Harmon walked back through the main doors. Delia was finishing her last round of the shift when Paulson found her. "Director wants to see you," he said. "His office. Now." She went. Gerald Fitch's office had the institutional neutrality of a space that had been decorated by committee, a framed hospital mission statement, a glass award from a regional healthcare association, a photograph of Fitch shaking hands with a state senator. He sat behind his desk with his hands folded, and Harmon stood near the window, and the HR director, a woman named Sandra Weil, who Delia had met twice and liked approximately 0 times, sat in the chair to the left. "Sit down, Ms. Voss," Fitch said. She sat. The conversation that followed was about 40 minutes shorter than the documentation that came out of it would imply. Harmon laid out the clinical violation. Nursing staff directing physician procedures, acting outside defined scope of practice, undermining attending authority in a trauma setting. Weil discussed the HR record, including the pattern of external reporting, which was characterized as a performance concern and a failure to follow internal channels. Fitch watched his hands while they talked and only looked up when it was time to deliver the conclusion. "We're placing you on administrative suspension pending a formal review," he said. "With pay for now, but effective immediately, you are relieved of patient care responsibilities." She looked at him. "The patient in the trauma bay is still at risk." "He's receiving appropriate care. His primary injury has been stabilized, but he presented from a rollover with significant deceleration force, and based on what I observed, there may be a secondary injury that hasn't been visualized yet. A vascular issue, possibly mesenteric. His gut instinct on admission was that he felt fine, which is textbook." "Ms. Voss," Fitch's voice sharpened slightly. "The clinical team is managing General Taft's care. Then the clinical team needs to know what I'm telling you." "What you're telling me," Harmon said from the window, "is another example of exactly the behavior that has created this situation. You have a systemic difficulty respecting the boundaries of your role." She looked at him. "My role is the patient." "Your role," he said, "is defined by your license and by the policies of this institution, both of which you've now violated." She thought about arguing. She had enough to argue with. The timeline, the documentation, the photographs, the emails she'd sent herself. But there was something in the arrangement of the three of them, the deliberate way they'd positioned themselves in this room at this hour, that told her the argument wasn't going to land here. Not today. Not in this room. She stood. "I'd like a written copy of the suspension notice." "It'll be emailed to you within the hour," Wiles said. "Thank you." She picked up her bag from beside the chair. "You might want to tell the clinical team about the mesenteric concern. Whether or not you believe me, it costs nothing to look." She walked out. The corridor outside Fitch's office was empty this early. Her footsteps were the only sound for a moment, steady on the linoleum. She passed the trauma bay on her way to the exit, and through the small window in the door she could see the monitors, the resident at the chart, and on the gurney the large shape of a man who was stable but not safe. She knew the difference. She pushed through the exterior doors into the parking lot. The Oregon morning was gray and cold and smelled like rain that hadn't come yet. She stood for a moment in the pale air, breathing it in, calculating. Behind her through the glass, she heard the trauma bay alarm start. Not the steady rhythm of the monitors doing their job. The other kind. She didn't go back in. She stood in the parking lot with her hand on her car keys, listening to the sound of the hospital, discovering, without her, what she'd already told them was coming. Her phone buzzed. Unknown number. She looked at it for a second before she answered. "Miss Voss?" The colonel's voice. How he'd gotten her number she didn't ask, because she already knew the answer to that, and knowing it meant something was happening that she hadn't prepared for. "I need you to turn around." She looked back at the glass doors. "The general is crashing," the colonel said, "and you're the only one in there who knew it was going to happen." She stood in the parking lot for exactly 3 seconds after the colonel spoke, the cold morning air sitting in her lungs like something she'd forgotten to exhale. Then she turned around. The automatic doors opened for her the same way they always did. No hesitation, no acknowledgement, just the mechanical indifference of a building that didn't know it had just thrown her out. She walked back through them and down the east corridor at a pace that wasn't quite running, because running in a hospital meant panic. And panic was the one thing she couldn't afford to introduce into what was already a deteriorating situation. She could hear the alarm before she reached the trauma bay, a sustained tone that the residents and the overnight tech would be treating as an isolated arrhythmia event, because that was the most common explanation, and the human brain defaults to the most common explanation. She knew it wasn't. She pushed through the trauma bay doors without knocking. The resident, a second-year named Park, who had been quiet but competent in her earlier assessment, was at the monitor calling out numbers that nobody was acting on fast enough. The overnight tech was drawing blood. Torres was on the phone, his voice tight in the way of someone who had just paged an attending and was trying to sound calmer than he was. General Warren Taft was conscious, which was worse than if he hadn't been. His eyes were open and he was tracking the ceiling with the particular expression of a man who understood something bad was happening to him and had decided not to show fear about it. His pressure was down. Not catastrophically yet, but the trajectory was clear. Delia went to the bedside. "I need a fast exam," she said. Park looked up. I thought you were suspended. I need a fast exam, and I need it now. Where's your portable ultrasound? The bedside ultrasound was in the corner. Park hesitated for 1 second, the specific hesitation of someone caught between institutional instruction and the immediate evidence of their own eyes. And then he got out of her way. She had the probe on Taft's abdomen inside 15 seconds. The image came up on the screen, grainy and immediate, and she moved through the quadrants with the practiced efficiency of someone who had done this in conditions significantly worse than a well-lit trauma bay. Morrison's pouch, splenorenal space, subxiphoid. She found the fluid in the left upper quadrant first, then the accumulation in the pelvis that confirmed what the chest tube and decompression had masked. Free fluid, significant volume. The mesenteric injury she'd told Fitch about 40 minutes ago while he was looking at his hands. He's bleeding internally, she said. Left upper quadrant, probable splenic laceration from the deceleration injury. He needs a surgeon, not a phone call. Torres had come off the phone. He was behind her now, looking at the screen. She watched him process the image, the way a trained physician processes an image, which is the same way anyone processes something that confirms a possibility they'd been resisting. That's... he started. Yes. She handed him the probe. Hold that position. Don't move it. She stepped back and looked at Taft. General, you have bleeding in your abdomen from the accident. We're getting you to the OR. His voice, when it came, was rougher than before but still controlled. A lifetime of training didn't let go even when the body was losing. How bad? Bad enough that we're not waiting. Something moved in his face. Not fear. Something closer to assessment. The way men who have operated in high-risk environments evaluate information and decide how to process it. He gave a short nod. Do what you need to do, he said. She was already at the phone. The next 12 minutes were the kind of 12 minutes that couldn't be planned, only survived. She got the OR coordinator on the line, gave the clinical picture in 30 seconds, and was told the on-call surgical team would be ready in 8 minutes. She called the blood bank. She updated the fluid orders while Park ran the IV lines and the tech drew the additional labs she'd called for. Torres was talking to an attending on the phone, not Harmon, a vascular surgeon named Dr. Reyes, who was already en route. She did not think about the suspension. She did not think about Fitch or Weil or the written notice that was going to be in her email in the next 45 minutes. She thought about the volume of free fluid on the ultrasound image and the rate at which a splenic laceration could escalate from manageable to catastrophic, and the window that existed between those 2 points. And she worked inside that window with the focused narrowness of someone who had learned a long time ago to make the walls of the world very small when something mattered. At the 8-minute mark, they wheeled Taft out of the trauma bay toward the elevator. He looked at her as they passed. She was at the foot of the gurney, and for a moment his eyes held hers with the directness of a man whose occupation had trained out of him any instinct toward the performative. It was a plain look. Acknowledgement. The kind that didn't need words and would have been diminished by them. She held the elevator door. Then they were gone. And she was standing in the trauma bay with Torres and Park and the tech, and the monitors were quiet, and the room had the specific flat quality of a space from which urgency has just departed. Torres looked at her. He opened his mouth once, closed it, then said, "Who are you?" "A nurse on suspension," she said. "You should document the timeline." She walked out. The colonel was in the corridor. He'd been standing there the whole time, she realized. Not in the room, not in the way, but present, watching through the window. He fell into step beside her without preamble. "Reyes is one of the best vascular surgeons in the Pacific Northwest," he said. "I checked. I know who Reyes is." "Then you know Taft has a reasonable chance." "Reasonable." She stopped at the nursing station and pulled up her documentation access on reflex, then remembered she'd been suspended and her access would be flagged. She stepped back from the terminal. "He has a better chance than he had 20 minutes ago." The colonel, she still didn't have his name, stood beside her with his arms at his sides and looked at the middle distance for a moment. He had the quality of a man who was thinking and didn't need to perform thinking. "You identified 2 separate life-threatening conditions in the same patient within 8 hours, he said. "The first one you caught on physical exam when the imaging missed it. The second one you predicted before it manifested." The physical signs were there. They were there, he agreed, And every physician in that room missed them. He paused. I've been in a lot of trauma situations, Ms. Voss. I know what clinical instinct looks like, and I know what training looks like. And what you did in there wasn't clinical instinct. It was something learned in a very specific environment. She said nothing. I ran your name, he said. Delia Voss. Oregon nursing license, active for 3 years. Before that, a 12-month gap. Before that, a short employment record at a hospital in Bend. Before that, he stopped. The record ends. People change careers. Not like that, he said. Not with a gap shaped exactly like that. He turned to look at her directly. I need to know who you are. Not for administrative reasons. Because the man in that OR matters to a lot of people. And so does whatever you know that nobody else in this building does. She looked at him. He was tired. She could see it now that she was paying attention. Not the tiredness of a man who'd been woken up, but the deeper kind that came from carrying something for a long time. What's your name, Colonel? She said. Arturo Mays. She considered him for a moment. Then she said, Give me a reason to trust you. He reached into his jacket and produced a photograph. It was worn at the edges, the way photographs got when they were carried in a pocket rather than filed in an album. He held it out, and she took it, and she looked at it, and she kept her face very still. It was a unit photograph. 12 people in tactical gear in front of a vehicle she recognized. The terrain behind them was specific in a way that would mean nothing to most people and meant everything to her. She was in it. Third from the left. She handed it back. Where did you get that? She said. Her voice came out even. General Taft gave it to me, Mays said. 3 hours ago, when he was still coherent, before his pressure dropped. He tucked the photograph back in his jacket. He told me that if anything happened to him, I should find out if the nurse who saved him matched the description of a woman who'd been listed KYA in a classified operation 7 years ago. He said she had a specific way of assessing a patient under pressure. He said he'd recognize it anywhere. The corridor was quiet. Somewhere above them, in an operating room she couldn't see, Warren Taft was on a table. He remembered me, she said. It wasn't a question. He never forgot you, Mays said. None of us did. She was quiet for a long time, long enough that a nursing assistant walked past, gave them both a look, and kept going. I need coffee, she said finally. Mays almost smiled. I'll find some. Tut. They sat in the family consultation room at the end of the west corridor, the one that always smelled faintly of burned coffee from the machine down the hall, and was furnished with chairs that were designed to be inoffensive and succeeded mainly in being uncomfortable. Mays had found a cup for each of them. Hers was bad. She drank it anyway. She didn't tell him everything. She told him enough. She told him about the operation, not the details, not the classified elements, but the shape of it. A forward position, a situation that had deteriorated faster than the intel predicted, a medevac window that had closed. She told him that the official report had listed her as KIA, because by the time anyone came back to look, there was nothing recoverable from that position, and the assumption had been reasonable, given what they'd found. She did not tell him how she'd survived. That was a longer story, and this wasn't the moment for it. She told him that when she had come back, 18 months later, through channels that required the cooperation of people she'd owed and who'd owed her, there had been a conversation with a specific department at a specific level of the government that had resulted in a sealed record and a new identity built cleanly enough that she could work, live, and file nursing reports without triggering flags. Until now, Mays said. Until now. She wrapped both hands around the cup. Taft recognized something. I wasn't as careful as I thought I was. You were careful, Mays said. He just knew what to look for. He was quiet for a moment. The KIA designation. You never tried to have it corrected? Correcting it required surfacing through channels that would have created a different kind of exposure. The situation when I came back was... She stopped, found the right word. Complicated. There were people who didn't want you found. She looked at him. I've read enough of what I can access to understand the shape of it, he said. I'm not asking you to confirm details. I'm telling you that I understand more than I'm letting on, and that what you did in that trauma bay tonight is going to make it very difficult for certain things to stay buried. He set down his cup. The general is going to want to thank you, and the general, when he wants something public, tends to make it public. Tell him not to. I'll pass that along. I make no promises about what he does with it. She looked at the burned coffee smell of the room, the acoustic tile ceiling, the framed print of the Oregon coast that someone had hung slightly crooked and nobody had straightened. I'm suspended, she said. As of about an hour ago. Yes, I heard. Harmon documented the clinical violation. Fitch signed off on it. There's an HR file. There's going to be a federal interest in everything that happened in this hospital tonight, Mays said. That tends to recontextualize paperwork. That's not how institutional bureaucracy works. No, he agreed. But it's how a national security review works, which is a different thing. He stood up. Stay in the building. Don't go to your car. I'm going to make some calls. She looked up at him. You can't unring this bell, Colonel. I know, he said. I'm not sure we should want to. He left. She sat at the uncomfortable chair and drank the rest of the bad coffee and thought about a unit photograph worn soft at the edges from being carried in a jacket pocket. Gerald Fitch arrived at his office at 6:45 to find two things he had not anticipated: a federal agent in the corridor outside his door, and a message from the hospital's legal counsel advising him not to finalize any personnel actions until further notice. He stood in the corridor for a moment, his briefcase in his hand and his suit jacket slightly askew, processing these two data points with the visible discomfort of a man whose morning had been organized around a different set of assumptions. The agent, a woman, compact, with the particular quality of contained attention that Delia had learned to recognize in people whose profession required them to notice things, introduced herself as Special Agent Renata Okafor, Department of Defense Inspector General's office. Mr. Fitch, she said, I need to review your hospital's maintenance and procurement records for the past 36 months. Fitch's voice came out slightly higher than he intended. On what basis? On the basis of a flag generated by an active federal audit of equipment maintenance compliance at regional trauma facilities with DoD patient agreements. She produced a document. Your facility treats military personnel and veterans under a standing agreement with Fort Caldwell. That agreement includes compliance obligations. We're here to verify compliance. We? Fitch said. Okafor stepped slightly to the side, and Fitch saw the second agent, a man, standing at the far end of the corridor with a laptop open and a patience that suggested he had been there for a while. Your records office opens at 7, Okafor said pleasantly. We'll wait. Fitch went into his office and closed the door. And what he did in there for the next 20 minutes, pacing, making phone calls, possibly sweating in a way his suit didn't quite conceal, Delia heard about later through the nursing staff grapevine, which at Mercy Hollow General was faster and more reliable than any official communication channel. She was in the break room when Sandra Weil found her. Weil looked different without the institutional composure she'd been wearing in Fitch's office earlier. She still looked put together. The HR director's armor was hard to dislodge, but there was something around her eyes that suggested the morning had not gone the way she'd planned it. Ms. Voss. Ms. Weil. Well sat down across from her, which surprised Delia. She'd expected standing or a doorway conversation, something that kept the physical distance of authority. The sitting down felt like a recalibration. I've been asked by legal counsel to advise you that your suspension is under administrative review, Weil said. Pending that review, your access credentials will remain active. My access credentials were flagged 20 minutes ago. I tried to document at the nursing station. A flicker of something crossed Weil's face. I'll have it update that. Thank you. Delia wrapped her hands around her coffee cup. Is that all? Weil looked at her for a moment, the specific look of a woman who had built a career on reading people and was not entirely sure what she was reading now. The federal agents in the corridor, did you know they were coming? I found out the same time you did. That's not what I asked. Delia met her eyes. Miss Weil, I've submitted 8 external reports to regulatory bodies about equipment deficiencies and patient safety concerns in this facility over the past 14 months. Any one of those could have generated an audit. I don't know which one did, or when, or how it connects to what happened last night. What I know is that a patient is in surgery, I'm sitting in the break room drinking bad coffee, and your legal counsel advised you not to finalize my suspension. She paused. I think we both know what that means, while left without saying anything else. Dr. Reyes came out of the OR at 9:17, Delia was in the corridor outside the surgical suite because Mays had asked her to stay in the building and the corridor was in the building and she'd needed to be somewhere that wasn't the break room. She heard the OR doors and looked up, and Reyes pulled down her mask and came toward her with the post-surgical directness of a woman who had just spent 2 hours doing precise technical work and had very little energy left for anything that wasn't also precise and technical. "Splenic laceration grade 3, Reyes said. "We repaired it. There was also a partial tear in the superior mesenteric vein that we almost missed." She stopped. "Almost," Delia nodded. "Your assessment was accurate," Reyes said. "The fluid accumulation pattern, the predicted injury site, all of it." She was looking at Delia with the particular scrutiny of one clinician evaluating another. "Where did you train?" "Oregon State Nursing Program." Reyes shook her head slightly. "I mean, before that." "Military," Delia said, because Mays had already pulled the photograph from his pocket in that corridor, and the thread was already unspooling. And lying to the surgeon who had just saved Taft's life felt like a small and pointless meanness. Reyes absorbed this without visible surprise. "He's stable," she said. "He's going to be in recovery for a while, but he'll make it." She looked down the corridor toward nothing in particular. "He kept asking about the nurse while he was going under." "What did he say?" Reyes looked back at her. "He said tell her she was right." I didn't know what that meant. "It means he's lucid," Delia said. Reyes almost smiled. She went back through the OR doors. Mays appeared from around the corner. He'd been giving the conversation space, she realized, which she filed away as a data point about him. He moved to stand beside her without crowding. "He's going to make it," she said. "I know. Reyes texted me." He looked at the OR doors. "The IG agents have been in Fitch's records office for an hour. They requested employment files about 20 minutes ago." She let that sit. "Mine's in there," she said. "Yes. If they pull it..." "The employment record is clean," Mays said. 3 years, good standing, 8 filed safety reports that are now going to be treated as documented evidence of institutional negligence rather than a performance concern." He paused. "The deeper record, the military record, that's a different conversation. That goes through different channels. I've already made 2 calls." "To whom?" He looked at her sideways. "People who can make decisions about sealed records." She was quiet for a moment. The OR corridor smelled like antiseptic and recycled air, the same as every other corridor in this building. "I didn't ask for this," she said. "I know. I built a life that worked. It was small, and it was quiet, and it worked. I know that too." He turned to look at her directly. "But you walked back through those doors this morning. You didn't have to. Taft would have died." "Yes," Mays said. "He would have. And you knew that, and you walked back in anyway, and now we're here." He let that be what it was. Some doors open, and you can't close them again. This is one of those. She looked at the floor tile for a moment. Beige, slightly scuffed near the baseboard, the kind of floor that got mopped twice a day and never looked clean. "What are the 2 calls going to produce?" she asked. "At minimum, a review of your designation. At maximum..." He paused, choosing. "A formal correction of the record. That has implications." "It does." "My identity can be managed," he said. "It's been done before for people in similar situations. The new name, the new record, those can stand. The underlying military history gets appended, not replaced." She thought about what that meant, the specific weight of it. "What does Taft want?" she asked. Mays was quiet for a second. "He wants to say thank you," he said, "and he wants to make sure the people who tried to throw you out of this building this morning understand exactly who they tried to throw out." "That's not about gratitude," she said. "That's about the general's ego." Mays's expression did something complicated. "Maybe a little of both," he admitted. "He's a complicated man. Most of them are." Down the corridor she heard raised voices, not medical, not urgent, administrative. She recognized Harmon's cadence before she saw him, the controlled aggression, the volume modulated just slightly above conversational so that everyone in earshot would register it without it being possible to call it shouting. He came around the corner with Fitch beside him, and behind them, Agent Okafor and her partner. Okafor was carrying a tablet and had the expression of a woman who had found exactly what she was looking for and was currently calculating what to do with it. Harmon saw Delia. His face did something that wasn't quite a full expression. The suppression of one, maybe. He stopped walking. "She should not be in this building," he said, and the words were aimed at Fitch, but his eyes were on her. She was suspended. Her access should have been revoked. "Dr. Harmon." Okafor's voice was pleasant in the way that suggested it had been specifically calibrated to be unpleasant. "I'd like to return to the conversation we were having about the maintenance log discrepancies from March through September of last year." "That conversation can wait." "It can't, actually." She held up the tablet. "These are the internal equipment failure reports submitted through your facility's external safety portal. There are 11 of them over 14 months. 8 were submitted by a single staff member. None of them resulted in documented corrective action." She looked at Harmon with the specific patience of someone who has time and knows it. "The defibrillator that failed in Bay 4 on 3 documented occasions. Can you tell me about the maintenance schedule for that unit?" Harmon's jaw worked. "Those reports were under review." "Under review for 14 months?" Fitch made a sound that was not quite words. "I'm going to need both of you available this morning," Okafor said. "We have a number of questions, and I'd rather work through them here than schedule a formal interview at our offices." She paused. "It's a courtesy. I'd encourage you to take it." The two men stood in the corridor, and something had shifted in the architecture of the space, the specific shift that happened when the people who'd been operating with institutional gravity on their side realized the gravity had changed. Harmon looked at Delia again. She didn't say anything. There wasn't anything to say that the morning hadn't already said better. He turned away. Fitch followed him. Okafor gave Delia a brief, neutral look that contained nothing she could interpret and followed them. Mays watched them go. "They're going to have a very long day," he said. "They've earned it." "The equipment reports," he turned to her. "You knew they'd matter. That's why you filed through the external portal." "I filed through the external portal because the internal process wasn't working," she said. "I filed them because the equipment was failing and people could get hurt. The fact that they become evidence of institutional negligence is a consequence, not a motive." "I believe you," he said. "I don't need you to." He looked at her with something that wasn't quite amusement. "No," he said. "I don't suppose you do." Her phone buzzed. The suspension notice from Vile's office, delivered as promised. She looked at it. Then 3 minutes later, another message from an IT address she didn't recognize telling her that her access credentials had been fully restored pending administrative review. She stood in the corridor outside the surgical suite of a hospital that had tried to push her out 6 hours ago, and she thought about the photograph worn soft at the edges and the unit she'd been part of before the world had rearranged itself around a single bad night, and the 7 years she'd spent building something small and functional and invisible. "What happens now?" she said. Mays looked at her steadily. "Now we wait for Taft to wake up." "And then?" "And then," he said, "the people who have been making decisions about your life without your knowledge for 7 years are going to have to answer some questions." Her phone buzzed again. This time she didn't recognize the number. She answered it. Static, then a voice she hadn't heard in 7 years. A woman's voice, clipped and precise, coming from a number with no area code she could place. "Ms. Voss," the voice said, "this is Section Chief Dana Lark. I think it's time we talked about your file." The corridor was very quiet. "I think so too," Delia said. The call lasted 4 minutes and 30 seconds, and when it ended, Delia stood in the corridor with the phone at her side and the specific weight of a conversation that had just changed the coordinates of everything. Mays was watching her. He'd given her distance during the call, 3 steps back, his eyes on the middle distance. And now he closed that distance without being asked. "Lark," he said. "Not a question." "You knew she'd call." "I knew someone would." He glanced down the corridor, checking the space with the habit of a man who did it automatically. "What did she say?" "She wants a meeting, in person, today." Delia pocketed the phone. "She said the file review she mentioned. It's not new. It's been in process for 8 weeks. Something triggered it before last night." Mays went still in the particular way of someone absorbing information and adjusting their internal map around it. 8 weeks. She didn't say what triggered it. She said she'd explain in person. Delia looked at him. Did you know about this before tonight? The pause before he answered was a half second too long to be nothing. I knew there was interest in the operation from 7 years ago, a review of the classified record. I didn't know it had progressed to your files specifically. But you suspected. I hoped, he said, which was a different thing, and he knew she understood the difference. She let it go. Not because she was satisfied with the answer, she wasn't, but because the morning was moving faster than her ability to be angry about any one part of it, and anger was expensive, and she didn't have the reserves right now. Where does Lark want to meet? Mays asked. Here. She's already in Ashford. That landed between them for a moment. She was here before Taft's accident, Delia said. Yes, which means whatever triggered the file review brought her to this city before any of this happened. That would appear to be the case. She looked at the ceiling for a second. The acoustic tile, the fluorescent tube that had been flickering for 3 weeks because nobody had submitted a maintenance request in the right format. Someone was watching this hospital, or watching me. Watching the situation, Mays said carefully. There's a distinction. Is there? He didn't answer that, which was its own kind of answer. Butson. Dana Lark arrived at Mercy Hollow General at 10:40, and she looked exactly like what she was. A woman who had spent 20 years in roles that required her to be underestimated and had made productive use of every minute of it. She was 50-something, with gray threaded through dark hair. She kept short, wearing clothes that were good quality and completely unremarkable. She carried a single leather portfolio, and she shook Delia's hand with the brisk efficiency of someone who had already decided this meeting mattered and didn't need the social scaffolding to prove it. They used the consultation room again. Mays sat off to the side, not at the table, in a chair by the wall, present but not participating. Lark registered this and didn't object. She opened the portfolio and produced 3 documents, which she set on the table but didn't push toward Delia. Operation Carver Ridge, she said. Delia kept her face still. 7 years, 4 months ago, Lark continued. A forward reconnaissance team operating under a classified joint authorization, penetrating a controlled zone in support of an extraction operation. The team took fire at the secondary exfil point. The medevac window collapsed. Official after-action report listed 2 personnel as KIA, 1 as missing, later reclassified to KIA when search teams found insufficient evidence of survival. She stopped and looked at Delia directly. You were the one listed as missing, she said. The 2 KIA were confirmed. Your situation was ambiguous. The report resolved the ambiguity in the direction of the worst-case outcome, partly because there were people at the command level who found that resolution convenient. Delia's hands were flat on the table. She was aware of how they looked, and she kept them still. What does convenient mean in this context? She said. Lark looked at the documents. The operation was authorized under a joint task order that required signatures from 3 commanding officers. One of those signatures was, we now believe, obtained under false pretenses. The operation was presented to that officer as a routine reconnaissance tasking. It was not. The extraction target and the nature of what was being extracted, those details were withheld. She paused. When the operation went sideways and there were casualties, the individuals who had misrepresented the tasking had a strong interest in the after-action report being filed quickly and the personnel questions being resolved without further inquiry. They needed the file closed, Delia said. They needed you specifically not to surface, Lark said, because you were the team's medic and you were present at the extraction point when the target was located. You saw what was extracted. The room was very quiet. Outside, somewhere in the hospital's circulatory system, the building continued its institutional business. Footsteps, a PA announcement, the distant rhythm of an elevator. Delia said, "What was extracted?" "Documents," Lark said. "And a person, a civilian asset, who had information about a procurement network operating inside a joint military contractor supply chain. The kind of information that, if it had been properly reported, would have ended careers." She opened one of the documents and turned it to face Delia. "We believe that network has been running for 11 years. We believe it has cost the government somewhere between $40 and $60 million in fraudulent contracts. And we believe that 2 of the 3 officers who signed that joint task order are still in positions where that network continues to benefit them. Basiku Oumparmeshot. Delia looked at the document. She looked at it for a long time. You're not here because of Taft, she said. General Taft's presence here is genuinely coincidental, Lark said, or as coincidental as things get in a situation this entangled. He's been aware of the Carver Ridge questions for some time. He's not part of the network. I want to be clear about that. But he's known things he couldn't prove, and when he heard last month that our investigation was approaching a point where your testimony might become relevant, She paused. He started looking for you. He got in a car accident. He got in a car accident, Lark confirmed. Her tone didn't carry anything obvious about that, but Delia registered what wasn't being said. Was it an accident? She said. Lark looked at her steadily. That is one of the things we are currently investigating. Mays shifted in his chair by the wall. A small movement, a weight adjustment, but Delia heard it. If it wasn't an accident, she said slowly, then someone knows Taft was looking for me. That is a reasonable inference, which means they know he found me. Also reasonable. Which means... She stopped. Yes, Lark said. The three of them sat with that for a moment. Delia's hands on the table were still flat and still. She made a decision about them and put them in her lap instead, out of sight, where she could be whatever they needed to be without managing how they looked. How many people know I'm here? She said. Specifically, how many people connected to that network? We don't know, Lark said. That's not me being evasive, we genuinely don't have visibility into their information yet. What we know is that Taft started asking questions through channels that weren't fully secure, and that 2 weeks ago there was a communication between two individuals connected to the network that referenced an upcoming inquiry and... She stopped, chose her words. And a loose end. Delia heard the phrase land and let it land. I need you to understand, Lark said, that our investigation is significantly more advanced than it was 8 weeks ago. We have documentation. We have a cooperating witness from inside the contractor operation. What we need, what would allow us to close the gap and build a case that survives a federal prosecution, is testimony from someone who was present at Carver Ridge, someone who saw the extraction firsthand. Me, Delia said. You, Lark said. You're the only one left who was. The coffee in the consultation room was even worse than the break room variety, which Delia hadn't thought was possible. She drank it because her hands needed something to do while she thought, and because there was something grounding about the specific awfulness of bad institutional coffee that she found, in this particular moment, useful. Mays had come to the table after Lark laid out the core of it. He sat across from Delia now, and the three of them were doing the thing that people in serious situations did when they'd absorbed a significant amount of information and needed to let it settle before they could think clearly about what came next. I need to contact my legal counsel, Delia said. Of course, Lark said, and I'm going to need the Carver Ridge file, whatever you can declassify. I've already initiated that process. Lark made a note in her portfolio. There are elements that will require a higher level sign-off, but the core operational record, the parts relevant to your testimony, those I can have to you by this afternoon. How long do I have to decide? Lark looked at her carefully. Formally? There's no decision with a deadline. You're not compelled. You never were. She paused. Practically, the investigation is at a point where the window for a clean federal prosecution is not unlimited. If the network becomes aware that we have testimony from a surviving witness, they'll begin moving assets and scrubbing records. We've seen it before. The window to act before they can do that is... How long? Delia said. 72 hours. Maybe 90, if we're careful. Delia looked at the table. And in those 72 hours, I'm what? A loose end. You're a protected witness, Lark said, if you agree to cooperate. And if I don't? Then you're a civilian with a complicated history and no formal status, and the protection becomes significantly more difficult to provide. The way she said it wasn't a threat, it was just accurate, and accuracy was harder to argue with than threats were. Delia stood up, not abruptly, but with the decision of someone who needed to be vertical for a few minutes. She walked to the window, small, frosted, overlooking the parking structure on the building's north side. Useful for light, not for view. She stood with her back to the table and looked at the frosted glass and thought about a unit photograph, soft at the edges. 2 of the 12 people in it confirmed dead 7 years ago. The others, she'd lost track of most of them. Life-scattered people. The 2 from Carver Ridge, she said, confirmed KYA. What were their names? A pause behind her. Sergeant Marcus Webb, Lark said, and Corporal Andrea Yost. She'd known both of them. Webb had been loud in the specific way of people who were covering for something. Not dishonesty, just the noise of a person who didn't know how to sit still. Yost had been 23 and had a habit of humming when she thought nobody was listening. Delia turned back from the window. I need 2 hours, she said. Then I'll give you an answer. Lark nodded. I'll be in the building. She spent 40 minutes of those 2 hours with the lawyer she'd retained 3 years ago for reasons that had nothing to do with this situation and everything to do with having lived long enough to understand that situations changed. The lawyer's name was Bridget Farrow, and she was in Portland, and she listened to a compressed version of the morning's events with the focused silence of a woman who billed by the hour and didn't waste it. If what they're describing is accurate, Farrow said, and the sealed identity arrangement was implemented under a DoD program, then you have existing legal protections that don't disappear when you cooperate. The identity stays. The nursing license stays. What gets corrected is the military designation. The KIA. Which becomes what exactly? They're restoring the record? Formally correcting it, Delia said. My understanding is the sealed identity framework stays intact, but the underlying military history is appended. I want that in writing before you agree to anything. Farrow's voice was even and unsentimental, which was why Delia had hired her. I want the protection agreement on paper, and I want the record correction language reviewed by someone with a DoD security clearance before you sign. Can you arrange that? Give me 90 minutes. Delia gave her 90 minutes. She spent the remaining time doing the one thing she'd had no time for since 11:47 the previous night, which was sitting down and not doing anything. She sat in the break room, different chair than before, one that faced the door, because some habits were structural. And she breathed slowly, and she let herself acknowledge that she was tired in a way that had nothing to do with the night shift. She was tired in the way of someone who had been holding a particular weight for 7 years, and had just learned that it was heavier than she'd thought, and also that she hadn't been holding it alone. The thought about Webb and Yost came back. It came back without warning, which was how those thoughts worked. She let it come and she let it sit, and she didn't try to move it along. Webb would have found the whole thing, the waiting, the negotiating, the legal phone calls. He would have found it intolerable. He'd have been pacing. Yost would have been humming something, possibly off-key, possibly a song nobody in the room knew. Delia didn't hum. She just sat. After a while, Torres appeared in the break room doorway. He was off shift, or should have been. He had the look of someone who had stayed past the end of their rotation because the morning had been too significant to leave. How's Taft? She said. Stable. He's been moved to the ICU. He's going to be there a few days. Torres leaned in the doorway. Reyes asked me to tell you she's entering a clinical note crediting the initial injury assessment to nursing staff. She was... He stopped, looking for the right word. She was specific about it. Reyes is precise. She said you had combat medic training. He said it without judgment, just the careful tone of someone who had learned that the person they'd dismissed the day before was more than they'd assumed and was still processing the gap. I had training, Delia said, a long time ago. He nodded. He was quiet for a moment, and she could see him working his way toward something. I should have moved faster, he said, in the trauma bay, last night. You moved when you moved. He's alive. Because of you. Because of the procedure that was performed correctly by the physician in the room, she said. That's what the chart says, and that's what happened. He looked at her with the specific expression of someone being offered grace they weren't sure they'd earned. Why? She picked up her coffee. Because what matters is that he's alive and the record is accurate. She paused. And because you're going to remember this for the rest of your career, and that's worth more than any documentation. Torres left. Farrow called back at 12:50 with a clearance-approved attorney on the line who had reviewed the protection agreement language and found it, with 3 specific modifications, acceptable. The conversation was technical and dense, and Delia followed every word of it. They negotiated the 3 modifications. 2 were accepted immediately. The third, a provision about the conditions under which the sealed identity could be disclosed to future employers, required a callback from Lark's office. The callback came in 11 minutes. The third modification was accepted. Delia called Lark and gave her the answer. The afternoon moved with the particular momentum of a thing that had been in preparation for longer than anyone in the room had known. Lark brought in 2 additional agents and a DOD attorney. Mays remained. Delia had asked him to stay, not because she needed a witness, but because she found that she wanted someone in the room who had known her as something other than a night shift nurse in a hospital that had tried to suspend her that morning. She gave her account of Carver Ridge in the consultation room over 3 hours. Not the compressed version she'd given Mays. The full version. The operational details. The target location. The asset they'd extracted. What she'd seen and heard before the exfil point took fire and everything came apart. She spoke with the specific precision of someone who had organized these memories long ago into a form that could be retrieved intact when necessary. Like documents in a sealed file she'd never expected to open, the agents asked clarifying questions. The DOD attorney made notes. Lark recorded the session with Delia's consent and asked the questions that built the structure around the account. Times, coordinates, the sequence of events, the names she could confirm. She gave them everything she had. When it was over, she was thirsty in the way of someone who has been talking for a long time, and her throat was dry, and there was a particular hollowness that came not from emotion exactly, but from having spent 3 hours making the interior things exterior, putting the 7 years held into the world, where it could be used. Mays got her a water. She drank it. That was... he started. I know, she said. The cooperating witness from the contractor side, he said. What Lark didn't tell you, because she's cautious about information flow, is that his testimony matches yours on 4 key points, points that neither of you could have coordinated on because you've never met. He looked at her steadily. What you gave them today closes the case. It opens the prosecution, she said. Closing it is someone else's job. Fair. She stood up and stretched her back, a functional, unglamorous stretch, the kind her body required after 3 hours in an institutional chair, and she walked to the door and stopped. The 2 names, she said, Webb and Yost. When the case closes, when the record is corrected, will they get corrected too? Mays was quiet for a moment. Their KIA designations are confirmed, he said carefully. But the circumstances of the operation, those will be corrected in the official record. How and why they died. Who was responsible for putting them in that position? She nodded. It wasn't everything. It was what there was. She pushed through the door into the corridor and walked directly into Marcus Harmon. Not metaphorically, physically. He came around the corner at the same moment she came through the door, and they nearly collided. And she stepped back, and for a second they were just 2 people who had almost run into each other in a hospital hallway. He looked wrong. That was the first thing she registered. Not angry, not composed, not the controlled aggression she'd cataloged all morning. He looked like a man whose internal infrastructure had taken a blow it hadn't been built to absorb. They subpoenaed the procurement records, he said. Not loudly. Almost quiet. She said nothing. Not just the maintenance reports, the procurement contracts, the vendor agreements. He was looking at her with an expression she hadn't seen from him before, which was the expression of a man who has just understood that the thing he's been standing on was not as solid as he'd assumed. There are invoices in there, equipment that was billed and never delivered. I didn't know about them. I want you to know that. I signed off on budget approvals without... He stopped. I didn't know. She looked at him. This man who had stood in an office at 5 in the morning and told her she had a systemic difficulty respecting the boundaries of her role. Then tell that to the agents, she said, clearly and completely and early. That's your best option. You could... He stopped again, started differently. You've been talking to them all afternoon. I have. Did you? I told them what I know, she said, which is what happened in this hospital and when. If what you're telling me is true, then that testimony doesn't implicate you in the procurement fraud. It implicates Fitch and the vendor contracts. She paused. But I can't tell them what I don't know, and I can't tell them what isn't true. So if you have information about what you knew and when, you need to be the one to give it. He was quiet for a long moment. You saved his life, he said. Twice. Rhea saved his life. I identified what was happening. He made a sound that wasn't quite a laugh. You're still doing that, making yourself smaller than what actually happened. She looked at him. Go talk to the agents, Dr. Harmon. She walked past him. At 3:15, General Warren Taft was extubated in the ICU and breathing on his own. At 3:47, he asked to see Delia. She'd been told this would happen. Mays had warned her when he got the call from the ICU nurse. And she'd had 20 minutes to decide how she felt about it, which wasn't enough time to decide anything useful. So she walked to the ICU with the same approach she applied to most things. She'd figure it out when she got there. He looked like what he was, a large man who had been through 2 surgeries in the past 12 hours and was operating on the margins of his available energy. His face was gray in the way of post-operative patients, and there were more lines in it than the photograph had prepared her for. And his voice when he spoke was rougher than it had been on the gurney. But his eyes were the same, sharp and direct, and carrying the specific quality of a man who had been making consequential decisions for decades, and saw no reason to stop. She sat in the chair beside his bed because standing over an ICU patient felt theatrical. Voss, he said. General. I'd say you look the same, but that would be a lie. A pause. You look tired. I've been awake for... She calculated. 22 hours. So have I. Slightly different reasons. He shifted against the pillow with the careful economy of someone managing pain. Lark talked to you. She did. Good. He was quiet for a moment, looking at the ceiling. I've been trying to find you for 8 months. Not because of the case. I didn't know about Lark's investigation until recently, just because... He stopped. Yost had a sister. She wanted to know what happened. The official record didn't tell her anything that was true. He looked at her. I thought if anyone knew the real version, it was you. She sat with that. Her name? She said. Kathleen, she's in Boise. I can give you her contact information if... Yes, Delia said. I'd like that. He nodded. Then he said, what you did last night in the trauma bay. The protocol was clear. The protocol was clear, he repeated, and something in his voice made the words land differently than she'd meant them. You always did that. Every situation, every call. You made it about the protocol, the procedure, the next correct step. Like if you kept it technical enough, it would be manageable. She looked at him. It's not a criticism, he said. It kept people alive, including me, twice now. He closed his eyes for a moment. The involuntary rest of a body that was repairing itself regardless of what its owner wanted to be doing. When he opened them again, he said, there's going to be a formal process, the record correction, a commendation review. I submitted the paperwork 6 weeks ago when Lark first briefed me, before I knew you were in Ashford. I didn't know if you'd ever see it, but I wanted it on file. She didn't say anything. I know that's not what you want, he said. You'd rather stay invisible. I had a life that worked. You had a life that was survivable, he said. Those aren't the same thing. The ICU was quiet in the way that critical care units were quiet. Not silence, but the muffled, monitored quiet of a space where serious things happened at low volume. The monitors above Taft's bed traced their steady lines. The commendation, she started, is already filed, he said. What happens with it is above my pay grade now, above both our pay grades. He looked at her steadily. But I wanted you to know. Whatever comes next, there's a paper somewhere with your actual name on it that says you didn't fail that mission. You survived it. She looked at her hands in her lap. They were steady. They were always steady when it counted, which was something she'd noticed about herself a long time ago and had never been entirely sure how to feel about. Yost's sister, she said. Kathleen. I'll have Mays send you the number. He shifted again. Get some sleep, Voss. You've been awake long enough. She stood to leave, and she was almost at the door when she heard him say quietly, not in the tone of someone asking a question, but in the tone of someone saying a thing they needed to say. Webb knew. Before the exfil point, he knew something was wrong with the authorization. He told me that afterward, in the debrief, Before we knew the operation had gone sideways. He said you'd flagged it." She stopped. "He said you told him the target extraction felt wrong, that you couldn't identify why, but the parameters didn't match the briefing." Taft's voice was low and even. He filed a separate note, internal. That note was part of what got buried when the after-action report was written. She stood with her back to the room for a moment. "Where's that note now?" she said. Behind her, a sound that wasn't quite silence, the specific quality of an answer that wasn't one. She turned. Taft was looking at the ceiling again, and his face had the particular stillness of a man who has said what he came to say and is now waiting to see what it sets in motion. "Mays," she said. From the corridor outside the ICU, where he'd been standing near the door the entire time she'd been inside, the colonel's voice came back, careful and measured and carrying the weight of something he'd been deciding whether to tell her since the beginning of the morning. It was in the file they buried, the same file Lark's team found 8 weeks ago. He appeared in the doorway, which means the people who buried it know it was found. He looked at her directly, and they know that note has your name on it. Her phone buzzed on her hip, a number she didn't recognize, different from Lark's number, different from any number she had context for. She looked at the screen, a text message, no name, no preamble, just 7 words. "We know you talked to them, stop." She showed Mays the screen without saying anything. He read it. His face didn't change in any dramatic way. No sharp intake of breath, no visible alarm. Just the quiet adjustment of a man recalibrating threat level, which was somehow more unnerving than a visible reaction would have been. "Give me the phone," he said. She handed it to him. He photographed the screen with his own device, then forwarded something to a number she couldn't see, then handed hers back. "Don't delete it," he said. "I wasn't going to." He stepped into the ICU and spoke to Taft in a low voice for 30 seconds. Taft's face, already tired, did something complicated. He nodded once. Mays came back out. "We're moving him to a secure room," Mays said. "Not a medical decision. Precautionary." He was already on his phone typing. "And you're not going back to your apartment tonight. I have a go bag in my car." He looked at her. "I've had a go bag in my car for 7 years," she said. "It's not paranoia if it's a reasonable precaution." "No," he said. "It's not." He put the phone to his ear. "Lark needs to see that message. Now." Bam. Lark was in the records office with her 2 agents when they found her, and she looked at the photographed message for approximately 3 seconds before she made 2 phone calls in rapid succession. The first was short. The second was longer and conducted in a lowered voice with her back to the room. When she turned around, her expression had the specific flatness of someone who had just confirmed something they'd hoped they wouldn't have to confirm. "The number the text came from is a burner," she said. "We won't trace it. But the fact that it was sent means they're monitoring communication channels we didn't know they had access to." She looked at Delia. "Which means they have someone inside, either inside this investigation or inside this hospital." The room shifted slightly. Not physically. The way a room shifted when a new variable entered it. "Inside the hospital," Delia said. Possibly both." Lark looked at Mays. "The timeline is compressed now. We need to move on the 2 primary targets tonight." "You have enough without my testimony?" Delia said. "We have enough for arrests, for a prosecution that sticks." Lark paused. "Your testimony moves us from probable to certain. And the note Webb filed, if we can use it in conjunction with what you gave us this afternoon, it dismantles their plausible deniability entirely." Delia thought about the 7 words on her phone screen, the particular quality of a threat that didn't bother being specific because the specificity wasn't the point. The point was the message that someone knew where she was and what she'd done and had decided she should know that they knew. "They're trying to determine if I'll stop," she said. "Yes." "If I stop, they gain time to move assets." "Yes." She looked at the floor for a moment, the same scuffed beige linoleum she'd been looking at for 3 years. "Then we don't stop." Lark nodded. No relief in it, just confirmation that the next phase could begin. "I need you somewhere secure while we execute, not for your protection only, for chain of custody on your testimony. If anything happens to you before this goes to a federal prosecutor, the defense will argue contamination." "Where?" "There's a DOD-affiliated facility 20 minutes from here. Not a base, a secure administrative site. We use it for sensitive witness situations. She looked at Mays. Can you transport? Yes. I need 30 minutes to brief my team and get the arrest warrants confirmed. She looked at Delia. Is there anything you need from the hospital before you leave? Delia thought about this. The patient's on her floor, but she was suspended, and the suspension was under review, and her patients had other nurses tonight. Room 9's confused elderly woman who'd been asking for Harold. The day shift would handle her. Mr. Alcott pulling out his oxygen line. She thought about Webb's internal note, buried in a file for 7 years, his handwriting on paper in a sealed folder. She thought about Yost humming off key. Nothing, she said. The 30 minutes became 45 because the arrest warrants hit a procedural snag at the federal level that required a phone call to a duty judge who was, at 4:30 in the afternoon, apparently in a meeting that couldn't be interrupted, and the waiting had the specific texture of a held breath. Delia spent it in the break room again because the break room was the place in this building where she'd spent the most time being who she actually was, not performing competence for administrators or controlled calm for patients, just a person sitting with bad coffee and the next problem. She ate something from the vending machine. She didn't taste it. She drank water, which she did taste, and made a note to herself that she needed actual food at some point before her body decided the issue for her. At 4:52, Lark appeared in the doorway. Warrants confirmed. Both? Both. The two primary targets were Brigadier General Stephen Orville, currently stationed at Fort Caldwell, and a man named Raymond Tuck, who served as the senior procurement officer for a defense contracting firm called Meridian Support Solutions, the company whose invoices had appeared in Mercy Hollow General's vendor records for equipment that had been billed and never delivered. The connection between those invoices and the Carver Ridge operation was the thread Lark's team had been pulling for 8 weeks, and it went like this. Meridian had supplied equipment to the Joint Task Operation 7 years ago. The equipment had been billed at 3 times the actual procurement cost. The authorization for that billing had gone through Orville's office. The person who had arranged for the joint task order to be misrepresented, ensuring that the operation's true scope wouldn't be reviewed by anyone with the standing to flag the billing, was Orville himself. Tuck was the financial mechanism. Orville was the protection. Together, they'd kept the network running for 11 years across multiple operations, multiple contracts, multiple false invoices buried in the supply chain of a military apparatus large enough that the individual line items rarely attracted attention. Until someone started paying attention. Delia had not been that someone, not intentionally, but she had been present at the moment the network's most significant risk had materialized, which was why her survival had been inconvenient, and why her testimony was now the clearest available path to dismantling what remained of the arrangement. She thought about all of this in the break room, chewing something that claimed to be a granola bar, while the warrants were confirmed and the agents prepared to move. She was not thinking about it cleanly. That was the human part, the part that didn't cooperate with the need for clarity. She was thinking about Yost's sister in Boise, who had been told something that wasn't true and had been living inside that untruth for 7 years. She was thinking about Webb's note, his handwriting, his observation, his name on a document that someone had decided was easier to bury than to answer. She was thinking about a parking lot in the Oregon morning and a hospital alarm starting up and the specific quality of the decision to turn around and walk back through the automatic doors. Those were not tactical thoughts. They were just what was in her head. At 5:10, Agent Okafor knocked on the break room door. "We're ready to move you." Delia stood up and threw away the granola bar wrapper and followed her into the corridor. They went out through the service exit on the hospital's south side. Not dramatically, not covertly, just the specific, undramatized practicality of people who needed to move without drawing attention. Mays was already outside with a dark SUV, engine running. A second agent Delia hadn't met was in the driver's seat. She was almost to the vehicle when her name came from behind her. She turned. Torres was standing at the service door. He'd changed into street clothes, end of shift, apparently, or past it, and he was holding his jacket in his hand and looking at her with the expression of someone who had spent a long time composing something and was now not sure how to deliver it. "I told Reyes," he said, "about what I almost did, or didn't do, in the trauma bay." She waited. She said to document it accurately and let the record stand on its own. He paused. I'm going to do that. Good, she said. The procurement investigation, Okafor told me this morning that the ventilator maintenance records in the trauma unit had been falsified, going back 2 years. He looked at her with the particular expression of someone who has understood that a pattern they'd been inside was larger than they'd known. I used that equipment on patients. I know, she said. You didn't know it was compromised. But you did. You filed reports for 14 months. I filed reports because equipment failing on patients is unacceptable, and nobody was fixing it through internal channels. She looked at him steadily. That's not righteousness. That's just the math. He nodded slowly. Will you come back to the floor? She looked at him. I don't know yet. It was the most honest thing she could have said, and he seemed to understand that because he nodded again and went back inside without pressing for more. She got in the SUV. The DoD facility was a converted administrative building on the eastern edge of Ashford, unremarkable from the street, with the specific invisibility of a building designed to look like it contained nothing interesting. Inside it was spare and functional: conference rooms, secure communication terminals, a small kitchen, a room with 2 cots that had been used recently enough that the linens were clean. Lark was already there, running the operation from a conference room through encrypted communications with her team in the field. Orville is at Fort Caldwell, she said when Delia and Mays arrived. He's in his quarters. We have confirmation from the base security feed. Tuck is at a hotel in Portland, which complicates the jurisdiction slightly, but not fatally. We have Portland field office coordinating. She looked up. The arrest will happen simultaneously at 6:30 to prevent communication between them. What about the inside contact? Delia said. The one who sent the message. We have a working theory, Lark said. She pulled up something on her tablet and turned it to face Delia. A name Delia didn't recognize. Hospital administrator. Not Fitch. Below Fitch, in the procurement division. His financial records show deposits over 18 months that don't match his salary. He's the one who flagged your safety reports and downgraded them in the internal system before they could generate compliance reviews. He buried the reports, Delia said. He buried the reports, and we believe he's the contact who notified Tuck when the federal agents arrived this morning. Lark set the tablet down. He'll be picked up in the same window. 3 simultaneous arrests, Mays said. 3 simultaneous arrests, Lark confirmed. And then we see what they say when they're separated and lawyered up and looking at the evidence package. She looked at Delia. Your testimony, Webb's note, the cooperating witness from Meridian, and 18 months of financial records. That's the package. Delia sat at the conference table. What are the charges? Federal procurement fraud, conspiracy to obstruct justice. Orville specifically faces charges related to the false representation of the Carver Ridge operational authorization, which carries additional weight under the UCMJ. Lark paused. And because of what happened to Taft's vehicle, we're pursuing a charge related to that as well, though the evidence there is circumstantial pending forensics. The room was quiet for a moment. If it wasn't an accident, Delia said. The brake line showed evidence of mechanical interference, Lark said, simply and directly. That evidence went to a forensics team this morning. Delia looked at the table. She was thinking about Taft in the ICU, gray-faced, breathing carefully, saying those aren't the same thing about survivable versus something more than that. She was thinking about the brake line on a vehicle on Route 9 and the rollover, and the 40 minutes he'd spent in the ER saying he was fine before his body told the truth. They tried to kill him, she said. We believe so. Yes, because he was looking for me. Bossing Martin. He was asking questions that, combined with Lark's investigation and Webb's note, would have been sufficient to bring the whole structure down. Mays said it quietly. You were a piece of it, a significant piece, but Taft had been collecting evidence for months. He was a risk independent of you. She let that settle. It didn't make it better. It didn't make it worse. It made it accurate, which was what she could work with. At 6:15, Lark got a confirmation call from the Fort Caldwell team. Orville was still in quarters. The Portland team had eyes on Tuck's hotel room. The third team, local Ashford, coordinating with the agents who'd been at Mercy Hollow all day, was in position at the hospital's administrative building. Delia sat in the conference room and waited. 6:30 came and went in the facility's secure conference room without drama, because the drama was happening elsewhere in compressed, documented, legally precise moments that she wasn't present for and wouldn't have been useful in. At 6:41, Lark's phone rang. She answered it, listened, said 2 words, and ended the call. "Orville is in custody," she said. At 6:49, the second call. Tuck, Portland. At 6:53, the third call. The hospital administrator, his name was Geary, Brian Geary, she learned it now, had been picked up in the parking structure of Mercy Hollow General while apparently attempting to reach his car with a laptop bag that the agents had found interesting enough to detain. "What was in the bag?" Mays asked. "Hard drives," Lark said. "We'll know more when the forensics team looks at them. But given the timing," she set down her phone. "He knew the arrests were coming. Someone in the warrant chain notified him." "Another inside contact," Delia said. "Or Tuck made a call between when we confirmed the warrants and when the Portland team reached his room." Lark's expression didn't change, but there was something in it. The controlled frustration of an investigator who was good at her job and had just discovered the problem was one layer deeper than she'd mapped. "We'll find it. It changes the timeline, not the outcome." "What does it change?" Delia said. "It means the defense will argue that Geary was tipped, which means the hard drives may be argued as evidence of a panicked attempt to destroy records rather than proof of premeditation. It's a distinction that matters in court." She said it evenly, without sugarcoating. "It makes the prosecution's job harder, not impossible." "But your cooperating witness from Meridian is clean," Lark said. "His testimony is independent of anything Geary touched." Delia nodded. She was doing the math in her head. The evidence, the chain of custody, the way federal prosecutions moved through time. This wasn't going to be over tonight. It was going to be over in months or years, in courtrooms with attorneys and motions and counter-testimony and the grinding procedural machinery of federal justice. She'd understood that going in. Understanding it and feeling it were different things. Mays came to stand beside her. He didn't say anything immediately, which was something she'd come to understand about him over the course of this day. He didn't fill silences with noise. "What happens to the hospital?" she said eventually. "Mercy Hollow General's DoD agreement will be suspended pending the compliance review," Lark said. "The equipment fraud, the invoices, the undelivered supplies, those are tied to Geary's actions in the procurement division. Fitch may face civil liability for failure of oversight. Harmon," she paused. "Harmon cooperated with the IG agents this afternoon. He gave them documentation about 3 specific vendor approvals that he was pressured to sign off on. His situation is nuanced." "He didn't know about the network," Delia said. "He knew something was wrong," Lark said carefully. "He chose not to ask questions that would have been professionally costly. That's not criminal, but it's also not nothing." It wasn't nothing. Delia sat with that. At 7:20, Lark left the conference room to take a call that required privacy. Mays stayed. Outside the facility's narrow windows, the Oregon evening had gone fully dark, and the building's interior lighting was the same institutional fluorescent as the hospital, as every institutional space Delia had spent the last 3 years inside. "How do you feel?" Mays said. She considered the question seriously, the way she considered most things. Like someone who's been awake for 26 hours and completed a marathon without knowing she was running one. "That's not how you feel," he said. "That's how you're functioning." She looked at him. He held it without backing down. "Tired," she said, "in a way that isn't about sleep." She paused. "And something else, something that doesn't have a clean name." "Relief has a lot of shapes," he said. "It's not relief." She thought about it. "It's more like the thing you feel when you've been braced for something for a very long time and the bracing was correct. It was warranted. The thing you were braced for was real." She looked at her hands. "That's validating in a specific way. But it's also heavy, because it means the years of bracing weren't excessive. They were necessary." Mays was quiet for a moment. 7 years of necessary," he said. "Yes." He didn't try to fix that. She respected him for it. At 8:05, Lark came back into the conference room. She was carrying her portfolio, and her expression had the particular quality of someone about to deliver information that was not what they'd expected to be delivering. "We have a problem," she said. Delia looked up. "Orville's attorney contacted the duty prosecutor 40 minutes ago. He's alleging that the Carver Ridge operational file, the one that contains Webb's note and the authorization records, was accessed without proper chain of custody documentation during the initial discovery phase 8 weeks ago." Lark set the portfolio on the table. "He's arguing that the evidentiary foundation of the warrant was procedurally compromised." Mays straightened. "That's a delay tactic." "It is, but it's a delay tactic with enough technical merit that a judge is going to have to look at it before we can proceed." Lark looked at Delia. "If the Carver Ridge file is ruled inadmissible as foundational evidence, we lose the historical thread that ties Orville to the network. We still have Tuck, we still have Meridian, we still have Geary, but the Carver Ridge connection, the one that demonstrates the network has been running for 11 years and that Orville has been the protection mechanism, that's in jeopardy." The room was very quiet. "What's the ruling timeline, Pistes?" Mays said. "The judge is reviewing tomorrow morning. We'll know by 10 a.m. Lark looked at Delia directly. "Your testimony about Carver Ridge is not part of the file, so it's independent. It can't be ruled inadmissible on the same grounds. But without the file to corroborate it, the defense will argue it's uncorroborated recollection from a witness with a compromised identity history." Delia heard the shape of what Lark wasn't saying. "They'll use my sealed record against me," she said. "They'll try," Lark said. "A witness who was officially declared dead, operating under a different name, with a history of institutional conflict at the facility where the primary victim was treated." She stopped. "Orville's attorney is good. He's going to argue that your testimony is inherently unreliable." "On what specific grounds?" "That your interest in the case is retaliatory. That you have a documented history of institutional conflict at Mercy Hollow General. That your identity itself is a construction that demonstrates a capacity for," and I'm reading from his filing. She consulted the portfolio. "Sustained and deliberate misrepresentation of the self." The specific phrasing sat in the room. "He's going to argue that the woman who hid her identity for 7 years is not a credible witness," Delia said. "Yes." She thought about that. The specific architecture of it. The way the same facts could be arranged to tell 2 entirely different stories. 7 years building a functional life, survivable but functional, invisible but honest, small but real. Reframed by a good attorney as evidence of a character capable of sustained deception. She was aware that she was tired, and that tired was not the ideal condition for clear thinking, and that she needed to think clearly. "What corroborates my account independently of the file?" she said. Lark looked at her. "The cooperating Meridian witness corroborates the financial mechanism. He doesn't have first-hand knowledge of Carver Ridge." "Taft," Delia said. "He knows the operation. He's a patient in an ICU who underwent major surgery 12 hours ago. His testimony won't be available for—" "He was conscious at 3:50, Delia said. "He asked for me. He spoke clearly. His recall was intact." She looked at Lark. "How soon can a federal prosecutor take a sworn statement from a conscious, medically stable witness?" Lark was quiet for a moment, working it. "Under normal circumstances." "These aren't normal circumstances." "No." Another pause. "If his attending physician clears him for a limited interview, and if the prosecutor is willing to go to the ICU rather than wait for formal scheduling, Reyes will clear him for 20 minutes, Delia said. "She's precise, but she's not bureaucratic. If it's 20 minutes with a controlled protocol, she'll say yes." She looked at Lark. "And Taft won't refuse. He's been trying to get to this moment for 8 months. Mays leaned forward. Taft's statement combined with Delia's testimony, with the Meridian witness on the financial side, and with Geary's hard drives, even if the file is ruled inadmissible, the case holds. "It holds differently," Lark said, "more vulnerably." "But it holds," Delia said. Lark looked at her for a long moment. Then she made a call. The call lasted 6 minutes. When it ended, she said, "The duty prosecutor is going to the hospital at 9 p.m. Reyes is being contacted now." She paused. "And there's something else. The hard drives from Geary's bag. Preliminary forensics has already turned something up." She looked at both of them. There's a communication chain between Geary and Tuck going back 22 months. Inside it, about 4 months ago, there's a reference to a federal audit concern and a name. She turned the tablet around so they could see the screen. The name was not Delia's. It was not Taft's. It was not anyone she'd expected. It was Sandra Weil, the HR director who had sat in Gerald Fitch's office at 5 in the morning and told Delia her suspension notice would arrive within the hour. The HR director who had walked to the break room 2 hours later and told her the suspension was under administrative review. The HR director who had, apparently, been communicating with the procurement administrator, who had been communicating with the defense contractor, who had been communicating with the man currently under arrest in Portland. While hadn't known about Carver Ridge, the communication chain made that clear. She'd been used as a conduit for hospital-level information, not a full participant in the network. But she'd known enough about the federal audit interest to flag staff activity to Geary, and Geary had flagged it upward, and what had come back down was the text message on Delia's phone. "We know you talked to them. Stop." Sandra Weil had not sent that message. But Sandra Weil was the reason whoever sent it had known, at the moment they sent it, exactly where Delia was and what she'd done. The room was very quiet. "She's still in the building," Mays said. "Yes," Lark said, "and she doesn't know we have the drives." Delia looked at the name on the screen. She thought about Viles sitting down across from her in the break room, which had surprised her. The sitting down, the recalibration. She'd read it as someone managing a difficult situation. She hadn't been wrong about that. She'd just been wrong about which situation. "She's going to run," Delia said. "Not because she's part of the network. She isn't, not really. But because when Geary's arrest becomes known, she'll calculate her exposure and she'll run." "Probably," Lark agreed. "So you need to move on her tonight." "Before the hospital grapevine gets there first," Mays said. Lark was already on the phone. Delia sat back and looked at the ceiling. The facility's acoustic tile, the same as everywhere. And she thought about the morning she'd walked into Gerald Fitch's office and the specific arrangement of 3 people in a room who'd decided something about her before she sat down. She thought about how rooms arranged themselves differently when the weight inside them shifted. Across town, in the ICU of Mercy Hollow General, the duty prosecutor was preparing to drive through the dark toward a hospital bed where a general who'd been looking for her for 8 months would give a sworn statement about an operation that everyone in this chain had assumed was safely buried. In Portland, Raymond Tuck was in federal custody with a lawyer who had just filed a motion that was going to keep a judge busy tomorrow morning. In Fort Caldwell, Stephen Orville was in a room with no windows and no comfortable chairs, and the particular silence of a man who had operated for 11 years on the assumption that the file was closed. And in Mercy Hollow General's administrative wing, Sandra Weil was sitting at a desk that she didn't yet know was the last night she'd be sitting at it, in a building where the records that would contradict everything she might say in her own defense were currently being copied to federal servers. Delia's phone buzzed. She looked at it, expecting Farrow or Mays or a number she didn't know. It was a text from a number she didn't recognize, but this one came with a name attached. Attached because whoever sent it had her in their contacts under a name she hadn't used in 7 years. The name that appeared in the Carver Ridge file. The name that was on Webb's buried note. The name that, as of this morning, existed only in sealed federal records and in the memory of people who had been in that unit. The text said, "I know what Lark hasn't told you yet. Call me." And below it, a callback number with a Fort Caldwell area code. She looked at the text for 4 seconds. Then she showed it to Mays. He read it, and his jaw tightened. A small movement, the first time she'd seen his control slip enough to show anything physical. He took the phone from her hand and walked to Lark, who was still on a call near the window. He held it in front of her face without interrupting her conversation. Lark read it, ended her call mid-sentence. "Fort Caldwell area code," Lark said. "Yes." "Orville's been in custody since 6:41. He doesn't have access to a phone." Lark looked at the number. "This is someone else on the base, someone who knows the sealed record well enough to have her previous name in their contacts." "Which means someone inside the investigation," Mays said, "or inside the original operation." Delia was still sitting at the table. She was thinking about the name the text had used. The name from before. The one that had belonged to a person who'd gone into a classified operation and not come out the way she went in. It wasn't her name anymore. She'd built 3 years of functional identity around a different one. But seeing it on a screen, attached to a phone number she didn't recognize, produced a specific sensation she didn't have a clean word for. Not fear. Something older than fear. Recognition. "I'm going to call it," she said. "Absolutely not," Lark said. "Someone on a Fort Caldwell area code has my sealed identity in their contacts," Delia said. "That information exists in 2 places: the federal file your team accessed and the original classified record. If it came from your file, you have a leak inside the investigation. If it came from the original record, you have someone inside the base who isn't Orville." She looked at Lark steadily. "Either way, you need to know which one, and the fastest way to find that out is to make the call." Lark looked at Maze. He looked back at her. "Trace it first," he said. 2 minutes. "Do it," Lark said to the agent by the door. The 2 minutes became 3. At the end of them, the agent looked up from his terminal. "Number registered to a burner purchased in Medford 6 weeks ago. No further trace." 6 weeks ago, Delia said, around the time Lark's team first accessed the Carver Ridge file. "That's when the leak would have started," Lark said quietly. "She was working it, the investigator's specific calculation of a problem rearranging itself. If someone inside the investigation became aware that the file had been accessed and that it could lead to a surviving witness, they'd want to know who found her first," Maze said, "whether it was us or them." Lark looked at Delia. The look lasted long enough to be a decision. "Put it on speaker," she said. Don't use your name, don't confirm anything. Let them talk." Delia dialed. It rang twice. The voice that answered was a woman's, older, controlled, with the specific economy of speech that came from years in environments where words had weight. "I wasn't sure you'd call." "I almost didn't," Delia said. "Who are you?" "My name is Colonel Vera Strand. I was the intelligence officer attached to the Joint Task Command at the time of Carver Ridge." A pause. "I signed one of the 3 authorizations." The room went very still. "The authorization that was misrepresented," Delia said. "Yes." No hesitation. "I've known it was misrepresented since approximately 3 weeks after the operation. I've had 7 years to decide what to do about that knowledge." Another pause, shorter. "I've made a number of wrong decisions in that time. I'm attempting to make a right one now." Lark was typing rapidly on her tablet. Maze had his hand on his phone. "What do you know that Lark hasn't told me?" Delia said. "The cooperating witness from Meridian," Strand said. "The one Lark's team has been relying on for the financial documentation. His name is Paul Gerard. He came forward 6 weeks ago." A breath. "Gerard was also present at Carver Ridge, not in the field, at the logistical staging level. He arranged the equipment billing for that operation specifically." "I know who he is in the investigation," Delia said carefully. "What don't I know?" "He negotiated his cooperation agreement without disclosing his full operational involvement. He told Lark's team he was a financial administrator with indirect knowledge of the network. He is not." Strand's voice stayed level. "He was the person who coordinated with Orville's office to ensure that the after-action report resolved the personnel questions quickly. He was the person who ensured that the search teams went to the wrong coordinates when they looked for survivors." The wrong coordinates. Delia sat very still. "He knew I was alive," she said. "He knew there was uncertainty about your status," Strand said, "and he made decisions that resolved that uncertainty in a direction that served his interests." A pause that carried weight. "I'm telling you this because his cooperation agreement, as currently structured, gives him significant prosecutorial protection. If his actual role at Carver Ridge isn't disclosed before that agreement is finalized, he walks away from the most serious element of what he did." Delia looked at Lark across the table. Lark's face was the color of someone who has just understood that their investigation has a structural problem they didn't build in. "Colonel Strand," Lark said, her voice precise and controlled. "This is Section Chief Dana Lark. I need you to stay on this line." A short silence. "I expected you'd be there," Strand said. "I need everything you have on Gerard's involvement, documented, if possible." "I have documentation," Strand said. "I've had it for 4 years. I've been deciding." Her voice did something on the last word, not breaking, the controlled sound of someone acknowledging a cost without performing it. "I made the wrong call for too long. I'm aware of that." "Can you come in tonight?" Lark said. "I'm already in Ashford," Strand said. I drove up this morning when I saw the federal activity at the hospital on the local wire. She paused. I've been sitting in a parking lot for 6 hours working up to this call. Mays looked at Delia. She looked back at him. 6 hours in a parking lot. A burner phone. A name and contacts that belonged to a sealed record. A woman who had signed an authorization that had been used to put 12 people in a field under false pretenses and had known it was misrepresented since 3 weeks after, and had carried that for 7 years while 2 of those 12 people were listed as dead and 1 was listed as dead and wasn't. Delia didn't feel anger about it. She felt something more complicated than anger, which was the recognition that the capacity for wrong decisions under institutional pressure was not exclusive to obvious villains. It lived in people who were otherwise functional, otherwise principled, otherwise trying. And it cost other people in ways the person making the wrong call rarely had to fully reckon with, until something forced the reckoning. Strand had waited 7 years for the forcing. "Send her the address," Delia said to Lark. Vera Strand was 61 and looked like someone who had slept badly for an extended period. Not tonight, not this week, but as a sustained condition. She sat at the conference table with a leather folder in front of her, and she didn't perform contrition. She just laid out what she had, methodically, in the order it had happened, answering Lark's questions with the directness of a person who had decided to stop managing information and start delivering it. The documentation she'd brought covered Paul Gerard's role at Carver Ridge in specific operational detail. His communications with Orville's office in the 72 hours after the operation. The coordinate discrepancy in the search order. The numbers that had sent the recovery teams to a position 2 kilometers from where the team had actually been. She had copies. She had originals sealed in an attorney's office in Portland with instructions to release them to federal investigators upon her request. A request she'd already made by phone from the parking lot. Delia sat across the table and listened and did not speak for most of it. There was nothing she needed to add. The account corroborated hers in every material detail and extended beyond it in ways that filled in the gaps she'd spent 7 years living inside. When Strand finished, she looked at Delia for the first time since sitting down, not with the look of someone asking for something, just direct, carrying the weight of what direct cost. "I can't give you back the time," Strand said. "No," Delia agreed. "Webb filed that note because you told him something was wrong with the authorization. He was right to file it. I was one of the people responsible for the authorization, and I should have been looking harder at what I'd signed off on." She stopped. "I wasn't." Delia looked at her. This woman who had sat in a parking lot for 6 hours and then made the call anyway. "Why tonight?" Delia said. "After 7 years. Why now?" Strand looked at the table for a moment. "Because you walked back through those doors this morning," she said. "I was monitoring the hospital situation because I'd seen the federal activity, and I was trying to understand what was happening, and I found the incident report, the trauma bay, the pneumothorax, the suspension, all of it." She paused. "And I thought about what it took to walk back through those doors knowing what you were walking back into. And I thought about the 7 years I'd spent in a parking lot, metaphorically, and I decided I'd been there long enough." The room was quiet. Lark's team worked through the night. Paul Gerard's cooperation agreement was suspended at 11:47 p.m., pending a review of his full operational disclosure. The duty prosecutor, who had already been at Mercy Hollow General taking Taft's sworn statement when the call came in, used language on the phone that suggested the review was not going to go well for Gerard. His attorney reached at home, stopped the interview that federal agents had been conducting, and requested a recess. The recess was granted. It didn't help. By 2 a.m, with Strand's documentation in the federal evidence chain and Taft's sworn statement on record, and Delia's testimony already filed, the structure of the prosecution had shifted from vulnerable to solid in the specific way of a building that had been shored up from multiple sides simultaneously. Orville's attorney's motion about the Carver Ridge files chain of custody was still pending for the morning, but its strategic value had diminished significantly. The file was now one of 4 independent evidentiary threads, not the central one. Gerard, facing the renegotiation of his cooperation agreement in light of his undisclosed role, made a decision at 3 a.m. that his original attorney had advised against, which was to provide additional information in exchange for a revised agreement. The additional information included details about two other individuals connected to the network that Lark's team hadn't known to look for. It was the kind of thing that happened when a carefully managed cover began to unravel at too many points simultaneously. The people inside it stopped protecting each other and started protecting themselves. Delia was asleep in the facility's spare room when most of this happened. Mays had told her at midnight that she needed to stop functioning on adrenaline because the adrenaline had limits and she'd been past them for hours, and she'd been too tired to argue with the accuracy of that. She slept for 5 hours and 40 minutes, which was not enough but was what was available. And when she woke up, the Oregon morning outside the narrow window was the same gray as it had been 24 hours ago, which felt like a strange kind of symmetry. She washed her face in the facility's utilitarian bathroom, drank water, ate something from the kitchen that was better than the hospital vending machine, which was a low bar. Mays gave her a compressed briefing on what had happened while she slept, and she listened to it with the focused attention of someone taking inventory of a situation that had moved while she wasn't watching. "Gerard's new agreement," she said. "Does it still give him protection?" "Reduced, significantly." Mays held a coffee cup and didn't drink from it. "He'll serve time. The extent depends on what the additional information he provided is worth to the prosecution." The two other individuals. "One is a sitting member of the DoD Procurement Oversight Committee," Mays said. "The other is a contractor executive who's been bidding on federal supply contracts for 9 years." He paused. "The investigation just got significantly larger." She looked at him. "How large?" "Large enough that it's going to be assigned a dedicated prosecution team," he said. "Large enough that Lark's office is going to be working it for the next 18 months. She thought about that. The scope of it. The 11 years, the $40 to $60 million, the false invoices buried in supply chains, the operations misrepresented to commanding officers, the people who'd been put in positions with information withheld from them. All of it running underneath the surface of institutional life like a slow leak nobody had wanted to find. "What happens to the hospital?" she said. Not for the first time, but the answer was different now than it would have been last night. Mercy Hollow General's DoD agreement is suspended, as Lark said. Fitch resigned this morning, about an hour ago, according to the administrator's office. Harmon has agreed to cooperate fully with the compliance review. Mays set down the coffee cup. Weil was arrested last night at her home. Lark's team moved at 9:40. She didn't run. She was in her kitchen when they arrived. Did she know they were coming? She knew something was coming. She'd apparently been sitting at her kitchen table for 2 hours. He paused. The agent who made the arrest said she looked relieved. Delia thought about that. The specific relief of a thing being over, even when the thing ending was bad for you. She understood it. Her charges? Obstruction, accessory after the fact for the equipment fraud, given the documented communication chain with Geary. He looked at her. She'll likely negotiate. She wasn't a principal, but she'll face consequences. She should, Delia said. Not with anger, just with the plain conviction that consequences were what accountability looked like when it was functioning correctly. Lark came to find her at 8:30 with a document in a manila folder and the expression of someone delivering news they'd been preparing to deliver for a while. The judge ruled on Orville's motion, Lark said. The chain of custody challenge was denied. The Carver Ridge file stands as foundational evidence. Delia exhaled. Combined with Taft's statement, Strand's documentation, and your testimony, the prosecution has what it needs. Lark set the manila folder on the table in front of her. And there's this. Delia opened it. It was a formal document on DoD letterhead. Dense with official language, but the substance of it was clear in the first paragraph and the last. A formal correction of the military record. The KIA designation removed. The classification on her operational history amended to reflect the accurate account of the Carver Ridge operation, including the circumstances that had led to the incorrect personnel resolution. Her original identity, formally and permanently linked to the sealed civilian identity she'd built, appended rather than replaced, as Mays had described. And at the bottom, in a separate section under the heading Commendation Review, a notation that the recommendation submitted 6 weeks ago by General Warren Taft, United States Army, had been reviewed, approved, and would be formally presented at a ceremony to be scheduled at the recipient's convenience. She read it twice, the second time more slowly than the first. The commendation recommendation, she said. He submitted it 6 weeks ago. Before he knew you were in Ashford, Lark confirmed. He'd been trying to correct the record for 2 years through appropriate channels. The channels were slow. He was losing patience. She paused. The accident on Route 9 accelerated a number of timelines, including that one. Is the accident? Forensics confirmed mechanical interference on the brake assembly, Lark said. That charge is now part of Orwell's indictment. Attempted murder, specifically. The evidence supports intent. The word sat there. Attempted murder. A brake line on Route 9 and a man who'd walked into an ER saying he was fine while his body quietly began to fail. She looked at the document in her hands. Her name, both names, old and new, linked officially for the first time, on paper that said the record had been wrong and was now being corrected. What do I do with this? She said. It was a genuine question, not rhetorical. Whatever you want, Lark said. That's the point. Cut. She went to the hospital at 10:15, not because anyone asked her to. Lark's work was largely administrative at this point. The arrests made, the evidence chain established, the wheels of federal prosecution turning in their slow and particular way. Mays had offered to drive her anywhere she needed to go. She told him she'd get there on her own. She drove herself. Her go-bag was still in the back seat where it had been for 3 years, slightly rumpled, serving its purpose. The hospital looked the same from the outside. Gray Oregon morning, the parking structure to the north, the automatic doors that opened for anyone without acknowledgement. She went through them. The east corridor was quiet at this hour. The post-morning rounds lull before the afternoon activity picked up. She walked to the nursing station and the day shift charge nurse, a woman named Patricia, who'd worked this floor for 11 years and had the specific competence of someone who'd outlasted every administrative change around her, looked up when Delia approached. You're back, Patricia said. Not surprised, just noting. For a bit, Delia said. Has Mr. Alcott been pulling out his oxygen line? Patricia's mouth did something. Twice this morning. I'll talk to him. She stopped at room 12 first. Alcott was 61 and stubborn in the endearing way of people who had spent decades operating on their own judgment and weren't inclined to revise the habit just because they were in a hospital bed. He looked at her when she came in with the expression of a man ready to defend his position. The oxygen line, she said. I feel fine. You feel fine because the oxygen line is doing its job. It's uncomfortable. Yes, she said. It's going to be uncomfortable for another 36 hours, and then you won't need it. She adjusted the line, checked the flow, made a note. I'm going to tell Patricia to check on you every 45 minutes. She already does. Every 30 minutes, then. He looked at her. You look like you haven't slept. I slept 5 hours. That's not enough. No, she agreed. It isn't. He looked at her for a moment with the directness of an older man who had learned that the people who came to care for you in hospitals were people, not functions. You okay? He said. It was such a plain question, the kind that could have been deflected easily and wasn't worth deflecting. Working on it, she said. He nodded like that was the right answer. She checked rooms 3, 7, and 9. Room 9's occupant, the woman who'd been asking for Harold, had been transferred to a skilled nursing facility the previous afternoon, her daughter having finally arrived from Seattle. Delia stood in the doorway of the empty room for a moment. The bed was made. The chair where she'd sat was pushed against the wall. She went to the ICU. Taft was sitting up when she arrived, which was either a good sign medically or a sign that he'd been arguing with his care team, possibly both. He was still gray around the edges, still moving with the careful economy of a body in active repair, but his eyes were sharp, and he registered her arrival with the focused attention of a man who'd been expecting her and had been prepared to wait as long as necessary. Reyes was there, making notes at the bedside terminal. She looked at Delia when she came in and said without preamble, 20 minutes, then he rests. Understood, Delia said. Reyes left. She sat in the chair beside the bed. Taft looked at her with the directness that she'd catalogued as his baseline. No softening, no performance of sentiment. Just a man looking at a situation clearly. You got the document, he said. It wasn't a question. This morning. Good. He shifted against the pillow. The commendation ceremony. I told them to schedule it at your convenience. That means whenever you're ready, including never if you prefer. I don't prefer never, she said, surprising herself slightly with the certainty of it. He nodded. The ceremony is administrative. What matters is what the record says. I know. Webb's note is part of the corrected file now, he said. His name is in there, attributed correctly, with an explanation of why it was suppressed. He looked at the ceiling for a moment. Yost's family was notified this morning that the operational circumstances are being corrected in the official record. A liaison from the Army will be contacting her sister. Kathleen, Delia said, you remembered. You told me her name. She paused. I'd like to be the one who calls her, if that's possible. Taft looked at her with something she hadn't seen in his face before, which was the particular expression of a person encountering someone doing the harder right thing when the easier right thing was also available. I'll arrange it, he said. They were quiet for a moment. The ICU monitoring equipment maintained its steady commentary. Somewhere in the unit, a nurse spoke to a patient in the low, reassuring tone of someone explaining a procedure. The investigation's expanding, she said. You know that. Lark briefed me this morning. 18 months, minimum. He didn't look pleased about it and didn't perform pleasure. I'll cooperate with whatever they need. I'm not going anywhere fast. He gestured briefly at his midsection with a wry quality that was the closest she'd seen him come to dark humor. You should have told me you were looking for me, she said, before you got in that car. He looked at her. I didn't know you were in Ashford until 3 days ago. 3 days ago, you could have called Lark and let her coordinate. I tried. The channels I had access to were the ones that had been compromised. He met her eyes. I made a judgment call. It was wrong. She looked at him. This man who had recommended her for a commendation years before he found her, who had driven toward a question he needed answered without knowing the brake line beneath him had been touched, who had asked for her by name while he was going under anesthesia. You almost died, she said. You saved my life, he said, twice. I think that balances. It doesn't balance, she said. That's not how it works. He almost smiled. No, he conceded. I suppose it isn't. He looked at her steadily. What are you going to do when this settles? She thought about it. The honest answer, not the comfortable one. I'm going to keep working, she said. Not the same way I've been working. Something's going to change in that. I don't know exactly what yet. She paused. There's a gap in how trauma facilities train nurses for mass casualty and blast injury triage. It's institutional. It's not a knowledge problem. It's a structural one. Nobody's building the curriculum that bridges military and civilian trauma protocols. He looked at her with the expression of someone who had just recognized the shape of a thing. You want to build it, he said. I want to make sure what happened in that trauma bay last night doesn't happen because a surgeon and 2 residents didn't have the framework to see what was in front of them. She paused. Not blame, just the gap shouldn't exist. It can be closed. He was quiet for a moment. I know people who fund that kind of work, he said. I know you do, she said. That's not why I told you. I know that too. He nodded slowly. But I'm going to tell them anyway. She stood. Reyes would be back in 6 minutes, and she'd said 20, and she meant it. Taft, she said. He looked at her. The photograph. The one Mays carries. He waited. I'd like a copy, she said. Something crossed his face. Not sentiment exactly. Something quieter than that. I'll have one made, he said. She walked out. Mom. The formal proceedings moved the way federal proceedings moved, with glacial institutional authority and occasional small urgencies that compressed specific days into long hours. Orville was arraigned 8 days after his arrest on charges that included procurement fraud, conspiracy to obstruct justice, falsification of military operational records, and attempted murder. He entered a not guilty plea that his attorney followed immediately with a motion to suppress that was denied within 48 hours. Raymond Tuck negotiated a plea agreement that gave him reduced charges in exchange for testimony against the 2 additional network members Gerard had identified. His attorney had argued for a lighter arrangement. The duty prosecutor had declined. What Tuck received was still a significant reduction from what the full charge sheet would have cost him, but it was not the arrangement he'd wanted, and the terms included restitution figures that would follow him for the remainder of his financial life. Paul Gerard's revised cooperation agreement was finalized after 3 weeks of negotiation. He would serve between 4 and 7 years, the range contingent on the value of his cooperation in the expanded investigation. The false coordinate order from Carver Ridge, the one that had sent recovery teams to the wrong location, was included in his formal sentencing statement as an aggravating factor. His attorney had argued against its inclusion. The judge had disagreed. Gerald Fitch resigned the day after his arrest was announced publicly, which came as a surprise to no one. His civil liability exposure from the equipment fraud was significant. His attorney issued a statement describing him as an administrator who had exercised insufficient oversight and emphasizing his lack of direct involvement in the network's operations. The statement was accurate in some of its details. It was also the kind of accuracy that carefully arranged itself around the inconvenient parts. Marcus Harmon retained his medical license. The compliance review found no evidence that he had direct knowledge of the fraudulent invoices. His culpability was defined as failure of oversight rather than participation. The Oregon Medical Board opened a separate review of the equipment safety concerns and his role in suppressing the reports filed through the external portal. That review remained open for several months. When it concluded, Harmon received a formal censure, not a suspension, not a revocation. A censure and a mandatory compliance training requirement and a notation in his professional record that would be visible to any credentialing committee that looked for it. He did not appeal it. Sandra Weil pleaded guilty to obstruction charges 8 weeks after her arrest, having negotiated a reduced sentence in exchange for a full account of her communications with Geary. Her attorney argued that she had been deceived about the nature of the information she was passing and had believed she was participating in a legitimate internal security protocol. The judge acknowledged the argument in sentencing. Weil received 2 years probation and a permanent bar from healthcare administrative work. She did not appeal either. Brian Geary, the procurement administrator who had downgraded Delia's safety reports in the internal system and tipped Tuck about the federal audit, received the harshest sentence of the hospital-connected individuals. His deliberate sabotage of the equipment safety process had contributed to documented patient care risk, and the prosecution had been specific about that in its sentencing memorandum. He received 14 months and a restitution order. Vera Strand was the most complicated case, and everyone involved knew it. She had signed an authorization under misrepresentation, had known it for 7 years, and had taken no corrective action until the morning she drove to Ashford and sat in a parking lot. The investigation she ultimately enabled with her documentation was significantly broader and more prosecutable than it would have been without her. Her cooperation was complete, documented, and material. She received immunity from prosecution in exchange for her testimony and her full cooperation with the expanded investigation. The immunity agreement was contested by 2 members of the prosecution team who found it insufficiently punitive. Lark had argued for it on the grounds that Strand's value to the case outweighed the symbolic value of charges against a cooperative witness whose culpability, while real, was substantially different in nature from the principals. The argument prevailed. Strand retired from active duty 6 weeks after the arraignments. She sent Delia a letter, actual paper, handwritten, which was a choice Delia registered as deliberate. The letter was 2 paragraphs. The first paragraph said what it said, which was an acknowledgement without a request attached to it. The second paragraph contained Kathleen Yost's phone number, which Strand had taken the time to locate independently. Delia had already called Kathleen by the time the letter arrived. The call had lasted 43 minutes and had not been easy and had been necessary and had mattered in the way that things mattered when they were the only version of something available and you did them anyway. Kathleen had asked one question that Delia hadn't been prepared for, which was she scared? And Delia had thought about it honestly rather than answering quickly, and she'd said, I don't know. She didn't show it if she was. She was competent and present right up until the moment she wasn't. And Kathleen had been quiet for a long moment, and then said, that's what she was like. That's exactly what she was like. And the call had gone on from there. Tartik. The commendation ceremony happened on a Tuesday morning in a conference room at Fort Caldwell, which was not a grand venue and was not trying to be one. Taft had healed enough to stand without visible effort, though Delia noticed he shifted his weight twice during the proceedings, which told her his recovery was real and ongoing rather than performed. There were approximately 30 people in the room, military personnel, several of Lark's team, Mays, Reyes, who had driven up from Ashford because she'd been invited and because she was the kind of person who showed up when she said she would. A few faces Delia didn't recognize in civilian clothes, from offices she could infer without being told. The language of the commendation covered the Carver Ridge operation and its aftermath, the corrected record, the events at Mercy Hollow General. It was formal language doing the work that formal language existed to do, making official what had been true for a long time and unrecognized. She stood and received it without performing anything about it, which was the only way she knew how to receive things. Afterward, Taft stood next to her while the room moved around them, people getting coffee, talking in the clusters that formed at the end of formal proceedings. "How does it feel?" he said. She thought about it. Alcott in room 12 asking if she was okay and accepting working on it as the right answer. The go-bag in the back seat. Kathleen Yost's voice on the phone saying that's exactly what she was like. Like something that should have happened a long time ago, she said. Which isn't a complaint, just an observation. Fair, he said. Also like something that doesn't change what I'm going to do next, she said. Which is the more important part. He looked at her with the particular expression she'd cataloged by now. The assessment of a man who spent his career making decisions about people and had learned to read the difference between someone performing conviction and someone carrying it. The curriculum, he said. The curriculum, she confirmed. I've started drafting it. I've been in contact with 3 trauma centers and a military medicine program in Seattle that's interested in a partnership framework. She paused. And I'm going back to Mercy Hollow General. He raised an eyebrow. Not because it's comfortable, she said. Because it's where the gap is visible, because the equipment failures and the suppressed reports and the institutional culture that made all of it possible, those things don't fix themselves when the administrators get arrested. They fix when the people working there have the framework to see them and the institutional backing to act on what they see. She looked at him. And because Patricia, the day shift charge nurse, has been there for 11 years and she's good at her job and she deserves colleagues who are actually trying to make the place work better. Taft was quiet for a moment. You're going to be a problem for every administrator who replaces Fitch, he said. Probably, she agreed. Good, he said. Mays found her near the door afterward, coffee in hand, wearing the expression of a man who had been part of a significant sequence of events and was still settling into what that meant. You sure about going back? He said. I'm sure about the work, she said. The location is a vehicle. He nodded. He understood the distinction. She could see that. The curriculum, he said. If you need access to military medical training records for the framework, protocols, field manuals, after-action medical reports, I can open some doors. I was going to ask you about that, she said. I know, he said. I was waiting for you to. She almost smiled. Thank you, Colonel. Arturos, he said. It was the first time he'd offered the first name without her asking for it. She registered it as what it was. The specific shift that happened when a professional relationship acknowledged that it had become something slightly different. Not less formal, exactly, just more honest about what the formality was covering. Arturo, she said. She drove back to Ashford in the early afternoon, the Oregon highway moving through landscape that was gray-green and familiar and asking nothing of her. The go-bag was in the back seat. The commendation document was in the manila folder Lark had given her, which she'd transferred to the glove compartment because she didn't need it in her hand to know what it said. She was thinking about Alcott and his oxygen line, and Patricia checking rooms every 30 minutes, and Torres in the doorway of the break room working his way towards something honest. She was thinking about a curriculum that didn't exist yet, and the gap it was meant to close. She was thinking about Kathleen Yost and the 43 minutes, and the thing Kathleen had said near the end of the call. I just wanted someone who was there to tell me it was real. That she was there and it was real. It was real. That was the thing that nobody could take back. Not Orville in his arraignment, or Tuck in his plea, or Gerard calculating his reduced sentence. The people who had been there were real. The work that had been done was real. The wrong coordinates had sent teams to the wrong place, but Yost had been there, and Webb had been there, and Delia had been there. And the fact of that didn't require anyone's official recognition to be true. The recognition was for the record. The record mattered, but it was downstream of the thing itself. She thought about walking back through the automatic doors at 5-something in the morning with the Oregon air cold in her lungs, because a man was dying, and she was the person who knew it, and there was no version of herself that didn't walk back in. Not because it was heroic, because it was the next correct step, and she had always known how to identify the next correct step. And that was the thing that had kept her functional across 7 years of necessary, small, and targeted. Not heroism, not idealism, just the stubborn, unkillable conviction that the work was real, and the patients were real, and the gap between what institutions said they did and what they actually did was a gap that real people fell through. She had fallen through one. She'd built a life on the other side of it. Some people who fell through gaps disappeared into them. Some people climbed back out and got quiet and stayed that way. Some people climbed back out and turned around and looked at the gap and started thinking about what it would take to close it. She had not chosen the path that looked easiest. She was aware of this, not with pride. Pride was a feeling you had when you were done, and she was not done. But with the simple satisfaction of a person who knows who they are and has stopped being uncertain about whether that person is worth being. She was worth being. Even when nobody in the building knew her name, even when the equipment report went into an internal system and got buried, even when the suspension notice arrived in her email at precisely 6 a.m. as promised. Worth being. Worth the work. Worth, finally, the record that said so. She took the Ashford exit, and the gray-green familiar landscape folded around her, and the hospital was 4 miles ahead, with its patients and its problems, and its day shift ending soon and its night shift coming on. She drove toward it,